Good evening. Today is Monday, August 18th, 2025. I call to order a meeting of the Brockton Finance Committee. Will everyone please rise and join me in honoring our country by saluting our flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Clerk, agenda item number 1, please.
Item 1, we have the acceptance of the minutes of the July 21st, 2025 Finance Committee meeting.
Accepted and placed on file.
We have the appointment of Dr. Victor Sebastian of Lexington, Mass. to the role of Commissioner of Health and Human Services for the City of Brockton for a 3-year term ending July of 2028. Invited Dr. Victor Sebastian.
Good evening, Mr. President. First of all, I want to thank all of you for authorizing and voting on this position. It was a home rule petition that was sent up to Beacon Hill from this body. It was ratified and signed into law by Governor Healy. We had a hiring committee. We narrowed it down to 2 individuals. You may have heard the name Dr. Sebastian. He has been working for the Board of Health under Dr. Eno Montesir relative to doing some metrics and data. He's been doing that for some time. He is a medical doctor, international medical doctor. He's worked for the CDC. He has had a great relationship with the Board of Health. We met with department heads last week, and Dr. Sebastian expressed his plans for the Health and Human Services Commission. We need to hire volunteers to serve a 9-member board, including 2 medical doctors that live in the city of Brockton. But just last week, actually, I also hosted Dr. Sebastian to introduce himself to all the health providers in the city of Brockton. And we did that at the Shaw Center last Wednesday morning at 9 o'clock. CEO from Brockton Hospital Signature was there. CEO Maria Celli from Neighborhood Health Center was there. VA representative was there. And we continued to talk about the uptick in HIV in Brockton, the uptick in TB in the city of Brockton. So I strongly recommend the ratification of this. The doctor is already working in this position. I strongly urge that you listen to him because he is an expert when it comes to infectious disease, and I believe he's here this evening. Thank you very much.
Thank you, Mr. Mayor. Dr. Sebastian, would you like to say anything this evening?
Good evening, everyone.
Good evening. The floor is yours, sir.
Okay. Good evening, everyone. I'm happy to be here. I'm Dr. Victor Sebastian. I was recently appointed, very glad to be also appointed as the Commissioner of Health and Human Services. I'm here before you this evening presenting myself to serve this city. I had already served this city as a medical epidemiologist for about 1.5 years, from January 2024 till July. When this position was made, this vacancy was posted, I consulted with the leader of the Board of Health under whom I was working, and I mentioned to him that this position is exactly what I've been trained for, and I'd be glad to apply for it with his permission or his blessing or his approval, considering that he was the boss underneath at which I was working. And he gave me the go-ahead that, yes, if you are qualified for it, please go ahead. There will be other people who will also be applying. So I applied. I was called for an interview. I presented myself for the interview, and subsequently I was notified that I've been selected. And I'm here before you today, glad to serve this city in this position.
Motion to recommend favorably.
Thank you, Doctor.
For the sake of discussions, I'm going to second that, but I have some questions that I'd like to ask.
Great. On the motion, Councilor Rodriguez.
Well, thank you, Mr. President. Doctor, welcome to the City of Brockton. I don't have any issues with your qualifications for the position that you actually are going to. But one of the questions that I have, and that I think that is actually for the entire body here, is I'm a little concerned with the process. I thought that ordinance positions were positions that the administration chose the individual, HR does the processing and selecting the individual, but the individual does not start to work until that position is ratified by this council. I mean, at least that's my understanding. Maybe I could be schooled in that process, that I'm not exactly sure how that thing works, but I believe that when we create an ordinance position, that position needs to be ratified or confirmed by the council prior to the person starting. Because the fear that I have, now let's say we put this through a vote and it does not pass this body. Now the question comes back to what happens. And that's the fear that I have, and that's a concern that I have even moving forward, in the sense that we're putting the cart before the horse. You know, that I think it's important for us to go through that whole process, but do not offer individuals the final position until that process is actually ratified. And just in case somebody has a better answer to this, I would love to hear it, but in my understanding is that that's what the process is supposed to be, and we're running the risk of basically either putting the council in a position to be the naysayer, or actually just kind of rubber stamping the process. And that's what I mean, as a council member that I still am, and I like to kind of get some clarification on that if I could. And that actually, I think I'd pose that to the clerk to see if he has anything else different to say.
Mr. Clerk?
You're mostly right in what you've said. Every ordinance position is not necessarily come before the council. For instance, city solicitor specifically is in that ordinance, that the mayor gets to appoint them without coming this. But this is a job that, in the creation of the job, it's specific that it's an appointment by the mayor with approval by the city council. So that is, now, what would happen where he's already working, and if we weren't to move forward, that is above my pay scale. That would have to be HR or the law department would have to give you an answer on that. I couldn't answer that, but I can tell you that it does need to be approved by the council. Mayoral appointment approval by the council.
Now, Dr. Sebastian, one of the questions that I had is that I look at this position as a position that we will be relying on for fund seeking, grant seeking, a position that when we were putting together this position, most of us that were part of that process was looking at this position as someone that's seriously going to go after, a great number of funding opportunities out there to bring into this community. Can you share with us some experience that you have in terms of either grant management or grant seeking or seeking opportunities? Because there's a ton of things that department could actually do with funds that belong to other people other than the taxpayers of the city.
Yes, I do. Very gladly so. I have extensive experience working in the CDC. I worked as a lead, in addition to my technical role as a physician and as a specialist, a public health specialist. I also had managerial responsibilities. I was a lead activity manager for a number of CDC grants. So I'm very experienced. I was with the CDC for 10 years, and this role was concurrent with my technical responsibilities. So I'm experienced in grant management as a donor. Now, prior to my working in, because CDC works as a donor, funds implementing partners, but we do what is called a funding opportunity announcement. We design a solicitation to which implementing partners would respond. So I'm extensively experienced in grant management, in designing funds, in soliciting for funds, in soliciting for applications to run for a program. That is one. But prior to my working with CDC, I worked in the Global Fund. As you may be aware, the Global Fund for Tuberculosis, AIDS, and Malaria is a funding that is provided by the G7 countries. It's a funding that is given out in two phases. You have a first phase, a phase 1, and a phase 2, to which you make applications. So I'm also experienced in soliciting for funding. So I have experience on both sides of the table. I have experience in designing an initiative and asking people to respond. In other words, announcing a funding opportunity, as well as in soliciting for a funding. soliciting for funding, I had that experience while working with Global Fund, because in the Global Fund, after each phase, you need to solicit for funding of your programs for the next phase. And that is a competitive solicitation because it's open to the countries that are eligible to be funded. So each country therefore competes with the other to get that funding. So I'm experienced in soliciting for funds to run my programs. I'm experienced in soliciting for implementing partners if I have a chunk sum of money to run an intervention with and I need persons to implement that intervention. So yes, I am experienced in fund management. And I also have trainings. I have trainings in fund administration. I did that while I was in the CDC. I have a certificate of international program management in terms of funding. We call it an IPO training. I have a training in grant management, which we are all expected to do while we're in the CDC so that we can manage judiciously the resources of the federal government. So, yes, sir, other than being a doctor, I'm also quite experienced in in the matters of soliciting for funds, in the matters of announcing a funding opportunity, and having implementing partners compete to be identified as the person to run with the initiative and therefore be funded, be the funded partner. So yes, sir, I am experienced in this.
I don't know if you know this or not, but I was one of the catalysts behind the creation of this department, to be honest with you, because I felt that our Board of Health or Health Department was just basically too focused and not widely focused on the issues and concerns that we had in this city. With the creation of this department, you're going to have a wide cross section of the populations under you. The health department will be there. The Health and Human Services will be there. The Council on Aging is also under your direction, to be honest with you. What specific experience have you had in working? I can understand that you worked on in epidemics and some of the infectious disease control and things like this, but secondary to what we do here is a lot of human services. You know, dealing with the homeless population that we're dealing with, the opioid involved individuals, with the variety of substance abuse that we see in the community, and yet you're dealing with both young people and the older population in the sense. So it's not just, you're not taking a grant from CDC and implementing it. You actually have to be the generator of ideas and programs to deal with the folks that fall within that box that we're dealing with from a cross-section. So what experience have you had in the past that dealt with that? And the reason why we're asking these questions is because this is the only opportunity that we have of asking questions of individuals that come before us for confirmation. So that's why we have to ask those questions.
Yes, I'm glad you did, sir. In addition to being a physician, I'm trained I specialize in public health. So I'm a trained public health specialist. Part of the discipline we go through in public health is social marketing, as well as developing skills beyond, seeing medicine beyond the paradigm of disease and a disease agent and health intervention. In the course of my training as a public health physician, I have developed social skills to market health. In marketing health, I need to collaborate extensively with all the other determinants of what will make one healthy. Within the social determinants of health, you're already exposed and you come to the understanding that beyond a pathogen, healthiness encompasses many other things. Some of those social determinants will need you to collaborate with other persons in other sectors that influence health services. So yes, as you have said, very importantly, one will need to collaborate with aging, one will need to collaborate with Housing Authority, one will need to collaborate with the Board of Health itself, which is like primarily concerned with epidemics and pathogen. But beyond that, one will need to collaborate with other social factors that determine health. So housing, aging, social services, substance use, behavioral issues, communication issues, all those are within the scope of what makes a thoroughly trained public health physician. So you might be surprised that as a public health physician, you see me designing interventions that deal largely with health communication. Yes, health communication is essential. You need to get your messaging across to influence sufficient understanding in people so that they will voluntarily change their behavior. You need to collaborate with people whose primary responsibility is in communication, therefore. So also, in the same way, you need to collaborate with persons whose primary responsibilities is taking care of the aged, social health workers, because you need their intervention. You need an effective and an efficient working on their part to bring your initiative to success. Their success, therefore, becomes your success because it impacts in the health of the community or the population for which you are serving. So, yes, in the realm of public health and community medicine, we are already trained and exposed to other agencies that are our co-partners in ensuring a healthy community.
But Dr. Sebastian, you will be the overseer of
Yes.
those departments. You're going to be the boss of the Council on Aging, the boss of the Human Services Department, the boss of the Health Department. You're the boss. It's
Yes,
not just developing.
my role as a boss.
No, let me just finish for a second. It's not just designing programs for people. It's to oversee the functionality, the day-to-day functionality of that department.
Yes, with a thorough understanding of what is going on there, collaborating with the agency becomes very easy because I'm their boss, but I'll be leading in a collaborative role. I'll be leading, working along with them. I'll be leading from a position of collaborative working, building synergies. With the understanding of what it entails, I already know where the shoe pinches, and I can know how to advise improvements in what is going on. I know how to advise synergies, how to advise relationships across the board that will improve what they are doing. Relationships across the board from agencies that may not be their own primary focus. For example, a communication team will be very helpful for an aging, for the Council on Aging. Why? A communication team will need to develop the intervention and market it appropriately, communicate it appropriately to the population concerned, so that you can thereabout bring about improvements in their health and in the effectiveness of the social services that you have designed. So yes, I'm the boss collaborating. I'm the boss. I have a thorough understanding of what it needs to achieve the desired goals. I have an understanding of how you need to bring synergies from the different elements of health, because health is determined by many collaborating factors. It is not just one party alone. You really need to collaborate to build an effective city, to build an effective population.
Finally, are you a resident of Brockton?
I'm not yet a resident of Brockton, but I do not see myself not living in Brockton. Presently, I'm a resident of Lexington.
Because you do know that you have a year or so to move into the city as part of this.
If I'm required to move into the city, it is okay by me.
Were you not told that you needed to move into the city?
I was told that it is residency. There was a term that was used. It is not residency required, but residency preferred. So if I need to move into the city, I'm happy to move into the city.
Well, I think that position should be a position of someone that lives in the city.
It's okay by me.
You know, I don't have any further questions at this moment, Mr. President. Thank you.
Thank you, Councilor Rodriguez. Councilor Farwell.
Thank you, Mr. Chairman. Just in answer to my colleague, the mayor would have the right under our city charter to make a 60-day temporary appointment for an ordinance position. So, and that's just a stroke of the pen, and usually the letter is transmitted to the clerk so that we're aware of it. So, pardon me, in terms of working at the Board of Health, if the mayor has done that, then he would have comported with the city charter. The one thing that I don't know, and Mr. Mayor, you may have to answer this, when we posted this position, did we have a job description? Because I always like, and I don't have the job description, so what I like to try to do is, again, pardon me, I like to try to match up what is admittedly a wonderful resume, but with the job description that we published to see if the two integrate and accomplish what we want to accomplish. Because this is a brand-new position. We've never had it before, pardon me. So it's so important to get it right.
No, I concur with that. This is a position that's long overdue for a city of 106,000 last census. I will tell you that the process was coordinated 100% through the Human Resources Department, Sandra Knight, who is an exceptional professional. I asked a committee, much like other hiring committees, to interview. We had my Chief of Staff, Sidney Merrow. We had Bill Forty, who is the Assistant Building Superintendent, on that hiring committee. We had Dr. Eno Monteser, Board of Health Director, and we had Sandra Knight. They narrowed it down to two candidates. They brought those two candidates to me. I met with both of those two individuals. Dr. Sebastian prevailed because he is the right person for the job. But the position was posted properly, and there was a job description.
Okay, it would be helpful if we had, I'm just speaking for myself, it would be helpful if I had the job description. The other question that I wanted to ask is, has the doctor had a chance to network and develop relationships here in Massachusetts? Because obviously, Commissioner of Health and Human Services in Brockton is going to have a relationship with Mass DPH and perhaps some other state agencies. Has he done that? That would be first question. And number two, did we, just as a matter of common business practices, check prior employment to make sure that his resume comports with whatever facts we might uncover?
Yes, Councilor. He was previously hired by the Board of Health, so there already was a due diligence process about a year plus ago for Dr. Sebastian to be hired by the City of Brockton through Board of Health. Again, that was coordinated through Human Resources. I can tell you that this individual sits on a weekly call that we still have every Friday. It's a Zoom at 2 o'clock with all the health providers in the City of Brockton, started by my office during the pandemic, and it still continues. When Dr. Maria Celli, the new CEO of Neighborhood Health Center, joined us last week, she was thrilled because Dr. Sebastian and her talk on that every Friday. He is someone that has, according to Dr. Eno Monteser, been a phenomenal addition to the team at the Board of Health. And one of my questions was, the situation flips. Eno was his boss in his prior role, and now he's Eno's boss. Is there an issue? And both gentlemen said absolutely not. The only thing that they want to do is make sure we have a healthy community within the City of Brockton and beyond. And that includes working with DPH because of the grant that we're going to be talking about in a little while, where we're working and partnering and collaborating with some other municipalities that touch Brockton. So I can just tell you that Sandra Knight would be able to give you that job description tomorrow. Again, this is finance. There wouldn't be a final vote tonight. So if it was passed, we'll get you anything and everything, all the members, whatever you need, we'll give you. But again, I stand by Dr. Sebastian. And I stand by him because I've interviewed him extensively and asked him the questions, and he gave me the answers that not just as mayor, but as a Brocktonian, I wanted to hear, talking about integrating himself with the pastors throughout the city of Brockton, because again, their reach is a lot farther than ours, reaching out to the diverse organizations in the city of Brockton. And he did that through his survey, which is extremely important to hear, the results of that. But also, Councilor, he's done it through day-to-day networking, and his partnership with the Commonwealth of Massachusetts, and even the CDC down in Washington, I think is going to help Brockton long-term. The financial grant right now is uncertain throughout the United States of America because of the shenanigans in Washington, but I can tell you that they're actively looking, and the leadership of Dr. Sebastian should reap benefits.
All right,
Thank you, Councilor.
Thank you, Mr. Chairman.
Thank you, Councilor. Councilor Razak.
Thank you. Good evening, sir.
Good evening.
So I'm just going to state a few comments. First of all, I agree with my colleague, Councilor Rodriguez. I was a bit disappointed that, the hiring process has already been done before we were able to, get to know you. Before this evening, we didn't receive an email or anything regarding your position. But I'm also disappointed you're not a Brockton resident, so you've been at the Board of Health for the past year, but you still haven't moved into the city, correct?
My position in the Board of Health, because I made that specific inquiry, I received the documents, the appointment letter and everything. I made that specific inquiry, and it was made to understand that because I'm presently renting in Lexington and it's far more expensive there, but I was made to understand that, yes, I'm welcome to move into Brockton, but it is not mandatory. So I'm in the process of settling, getting a property of my own is actually my biggest preference. So that's why I told you that I'm happy to move into Brockton if it is required. It's not going to be an issue for me at all because I'm already in a search process.
Sure. No, so, my comments are not personal to you, but just in general to the position. I feel it's very late in the year, especially with an election year. In 4 months, we will have a new mayor and possibly a new city council, and I felt it was very, this position, we've waited this long to fill it, we should wait another few months, especially because I don't think anything's going to happen in the next few months. As you know, the Board of Health is totally broken. We don't even have a board that meets, a full board that meets. I don't think we have the...
We don't have a board anymore, Councilor. We don't have a Board of Health.
This person was hired. So, that's really important to me. There's a lot of stuff that had been happening in the past that all of a sudden the board doesn't exist, so where do we go from there? So I think this is just too complex to kind of just randomly. I know you said you had 2 candidates, but I don't feel that...
No, two finalists, Councilor.
I don't, once again, this isn't just about the candidate that's before us this evening. It's about the whole process. I feel it's, you're an outgoing mayor, and with all due respect, I just feel like this is something that could be dealt with at the beginning of the year, especially with the new council. And I got a copy of the job description, and I have issues with it because part of the job description states that this individual will enforce state and local ordinances as far as health code. And I feel like a few years ago we created the inspectional services. They hold the inspectors that are enforcing code, state code, health code. How is this gentleman going to oversee that? I'm just trying to figure out how what's happening, and we try to fix one thing in the city and something else falls apart. So I feel like we're rushing into something that we don't need to really rush into, and I really would, as the resume is impressive, except all the experiences outside of the United States. I mean, I believe the gentleman received a certificate in epidemiology in 1 month from August 2017 to September of 27. It was like within a month, like everything was short-term that was done here in the United States. I would just...
Well, if I could, Councilor, with all due respect, I disagree that we're being rushed on this. This is a matter that was signed into law by Governor Healy, and we posted it trying to get medical doctors. We were not mandated to get a medical doctor. Originally, we were gonna if the home rule didn't pass. However, we've been working on this, and it wasn't just 2 people, those 2 finalists. One was an MD, one was not an MD. But we got people that had no medical experience whatsoever that applied. And so we had to keep posting it because we needed someone. When Doctor applied, having already worked at the Board of Health, he already had experience, he already knew the city of Brockton. So it doesn't matter if I'm outgoing or not. This is a position that is needed, that actually started and was created by this body that the governor supported and I support. And regardless of who succeeds me, I don't really care who succeeds me as long as he or he does a good job. The thing I care about is, why do we have an uptick in HIV and TB? And we don't have a Board of Health right now because the membership disbanded and the members resigned. What we do have right now is potential litigation, because what falls under the auspices of this position is tobacco, and we are being potentially sued because of the inability to act on certain tobacco licenses. We will then be able to have a committee set up, and I said it's 9 people, but we're going to need a quorum. But 2 of those are mandated by the ordinance to be MDs. It's going to be difficult to find, but that's why we met last week at 9 o'clock at the Shaw Center with all the medical providers to ask them to try to help us on that. I think the other thing is every position that's an ordinance works with other department heads. So Dr. Sebastian will be working with the Jim Ploufs of the world and the Ena Monitors of the world. Yes, he falls under the auspices of being the leader. That's the pecking order of the organization. But ultimately, Janice Fitzgerald's an expert when it comes to elders. He would rely on her. Ultimately, it has to go through him as the commissioner. But it would be short-sighted to say that he would not leverage the experience of all the other people. And I can't answer his resume. He can answer that.
Sure, thank you.
Okay, sorry, you misunderstand my qualifications. I'm a medical doctor, an MD. After my medical degree, I practiced for 10 years as a clinician, a physician, and thereafter I chose to specialize in public health medicine. In public health medicine, that's a 6-year specialization experience, residency. I did that, and I qualified with a fellow in public health, which is equivalent to a postgraduate degree, a doctorate, a postgraduate doctorate, a professional doctorate in public health. So in addition to having a professional doctorate in public health, I have a master's of public health degree. That is a full 1-year, minimum 1-year course. Now, in addition to these degrees, I have postgraduate certifications with CDC in-house trainings. Some of those postgraduate certifications are the things you see that look like a 1 month or a 1 month duration. Those are postgraduate certifications within the CDC. Most of those are obtained at the CDC Training Center in Atlanta. But some of those are also obtained at the Imperial College London. It's at the Imperial College London I did my specialized training in epidemiology. It is not just a degree in epidemiology, it is a mathematical modeling specialist course. That is a postgraduate certificate. It is not a degree, it is even people who have a degree come to have some extra training in a very narrow stream of epidemiology called mathematical modeling. That I did in Imperial College. So it looks like a 1 month, it's not a 1 month degree in epidemiology. I'm already trained extensively in epidemiology, 6 years as a resident, 6 years, prior to that, 6 years training as a physician, so 6 years additional as a public health specialist, 1 year minimum master's in public health. So these additional trainings are like, for example, in my training course, there were other physicians in the Imperial College who are also doing that mathematical modeling in epidemic control. So that's what you saw as a 1 month course in epidemiology. It is not 1 month for someone who doesn't know anything about epidemiology. It is 1 month for people who have attained advanced degrees in epidemiology already.
Sure.
So
No, I
those
understand.
trainings are not, those trainings are detailed, they're elaborate, and they're for postgraduate persons already, not for freshers.
No, I understand, thank you. So But most of your experience from looking at your resume, because that's all I've seen, was all in Nigeria. Did you have
I was
any?
working with the U.S. Embassy in Nigeria, CDC in Nigeria. As you may be aware, CDC has international postings in different countries. So I was working with the U.S. Embassy, CDC in Nigeria.
As a medical
CDC
doctor?
is U.S. CDC country office in Nigeria. I worked there for about 10 years, 8 years exactly as a staff, 2 years prior as a consultant contractor to run the multi-drug resistance survey that was sponsored by the CDC on a country basis for Nigeria. That I did after I left the Global Fund job. The Global Fund, I was on Global Fund as a country specialist for Nigeria. Global Fund is a fund that is put together by G7. I believe you know what the G7 countries are. So I got the Global Fund job to be the technical specialist for Nigeria. So,
That's fine.
So
I understand. No, it's-
my degrees are not 1 month. They are extensive trainings.
Sure, I understand. And once again, you have a very vast, there's a lot of information on your resume, so I tried to look at it as best as I could. And because to me, this position's really important, and I feel that management skills is really what's needed, like to be able to manage. You have all these departments that are going to be under this position, so I really wanted a candidate with very good management skills.
To put some further light, my 10 years with CDC were all managerial roles because I was working at a country level, supervising subnationals, which are states and local government areas. So my interactions were with CDC implementing partners, ministries of health, and local, that is what you call it, in the US it's county, but in Nigeria it's local government. So local government level. So my managerial experience, therefore, is I managed implementing partners, funded partners by CDC as a lead activity manager. I manage state ministries of health. I interacted with those different government officials in running HIV and TB programs, interventions that were funded by CDC or the Global Fund. So I have some good managerial experience.
Okay.
Prior to leaving concluding my residency training, I was the chief resident. As the chief resident, I'm responsible for all the resident doctors in the Department of Community Health training because I'm the chief resident. At different times, I had no less than 25 resident doctors under my supervision. And this goes way back to 2004. So from 2004 till 2007, I was a senior resident managing others, that is within the hospital, specializing in public health. After then, I got this job with Global Fund at country level, managing different levels of subnational programs that were funded by the Global Fund. From there, I joined the CDC at country level, managing CDC implementing partners, all the ministries of health of the different states in Nigeria, all the local government boards of health of the different states in Nigeria, collaborating on issues of HIV, issues of TB, HIV, and other issues of health system strengthening. Because in addition to the HIV grant being a HIV grant, we were also using it, the CDC was using that as a means to strengthen the local health infrastructures within the recipient countries in which CET was working.
Thank you. So a couple of other questions for you. You've been at the Board of Health in Brockton for how long?
1 year and a half.
For a year and a half, okay.
Right.
And what do you feel was your greatest accomplishment that you've done there? What have you been doing at the Board of Health?
On joining the Board of Health, I was saddled with the responsibility of reviving and bringing to success a needs assessment survey that was already, I call it a needs assessment survey because it falls under that category of surveys, but actually it's a community health assessment. That was what it was named, of the city of Brockton. That survey was designed to determine the gaps and the felt needs of the community with regards to the health needs of the community. That survey had been started, but it ran into issues. I revised the protocol, I mobilized my team, and I got that survey concluded within three months. Analyzed it and produced very useful results out of it that we can make use of. I've presented that report to the mayor. The mayor is happy with it, and I'm ready to work with it because it has given us substantial insight into the felt needs of the community, into the gaps that are in the community. And these are things I've been trained for, and I see as low-hanging fruits that we can easily start off with and improve the health of members of this city. Thank you very much.
So this report, did you say, is it public yet, or you said you've submitted it to the mayor, or?
As a staff in the Board of Health, my responsibility is to analyze the survey, produce a report, and submit it to my boss, which I did.
Okay.
And I particularly made it in a user-friendly version. I presented them in slides. I'll have the database. The database is intact, but I brought out the essential things, presented them in slides, and submitted to my boss. Together, we came to the mayor and we submitted it to the mayor. That is my responsibility. If the mayor decides to make it public, I'm happy with it. If he decides to make it an internal use document, I'm happy with it. But I've submitted the report as is expected of me.
Okay, so that's what you have been working on for the past year and a half, is
That
the
is
report?
one of the things. What you said, major accomplishment. That is one of the accomplishments I got done within 3 months. But subsequent to that, one of the primary reasons why I was hired was to help the Board of Health monitor the major epidemics that are ongoing in the city, primarily COVID, and we are happy that it's waning off, COVID, and I've also noticed while I've been there with them, the emergence or re-emergence of TB, which already I'm beginning to discuss with the Board of Health as well as the mayor, some of the things we can do. Having had the privilege of extensive experience in TB, I was the national consultant under the Global Fund for TB control in Nigeria, which is one of the high-burden TB countries globally, the 4th highest-burden TB country globally. So that gives me extensive and substantial experience. So the TB burden in Massachusetts is just a tip of the iceberg compared to high-burden countries, because there is no way U.S. is part of the high-burden countries. But having had an extensive experience in a high-burden country, facing helping the country to successfully tackle the issues of TB, and not only TB, but even multi-drug resistant TB. If you go through my survey, through my resume, you will see that one of the major things I did while I was with the Global Fund was that I discovered that TB treatment in Nigeria was not succeeding because I made a suspicion that there might be the possibility of drug resistance. Now, in the concept in public health sphere, drug resistance is a major treatment or intervention headache you will not want to have, because it simply means that the medications you are using are not working. Now, for TB, that is an extraordinary burden. Why do I say so? Because already for the treatment of TB, it's a cocktail of antibiotics. You don't use it for 5 days or a week. You use it for a whole 8 months. Now, and you use it daily for 8 months. Now, you can imagine the pill burden of taking 4 or 5 different antibiotics every day for 8 months, only to relapse back into TB. So I advise the protocol to investigate if there's drug resistance TB in Nigeria. That protocol was to be on a national scale. I presented that protocol in a multi-partner meeting, the planning cell meeting. The CDC representatives that were in that technical working group noticed that presentation, requested a copy of it, sent it to Atlanta, and decided to sponsor it, even though I was working on Global Fund. Here is a Global Fund staff making a presentation, Global Fund for Tuberculosis, AIDS, and Malaria, making a presentation on TB. The CDC took interest in it and decided to fund it. Subsequently, therefore, I was hired by the CDC because that was the terminal part of my my stay with Global Fund. I was hired by the CDC as a contractor for 2 years to run that survey on a national scale. And permit me to mention that that survey is the first time drug-resistant TB survey will be done on a national scale in any country. That applause goes to CDC for sponsoring that survey. Why? Because drug-resistant drug-resistant TB surveys are notoriously difficult surveys to conduct. Notoriously difficult because of the logistics involved and the issue of the very specialized laboratories that you needed. But we developed the logistics, we got that survey successfully done, and that study resulted in us discovering that there's primary resistance to TB as well as secondary resistance to TB. Secondary resistance is the terminology we use when the treatment had gone ORI. What do I mean by ORI? The patients could not comply with the drugs, and subsequently, therefore, the germs became resistant to the drugs. That would be secondary resistance. Primary resistance would be where the drugs were not working ab initio. Neither of this is good news. Primary resistance will mean that you have subjected this person to an 8-month course of medication unnecessarily. Secondary resistance will mean that this person had gone through an 8-month course of drugs and yet is relapsing back into TB. So none of them was good news. But we discovered, and therefore it resulted in revision of the drug cocktail for TB in Nigeria. This is a major, major achievement. It's there in my CV. So I'm extensively experienced in conducting surveys, in managing epidemics, in disease control, in helping populations to become healthier. So on my coming in here and noticing that, yes, COVID is waning, but TB is rising, I immediately began to engage with Dr. Eno as to what we can do to improve the situation in the city of Brockton. And I'm very happy to do that. I'm very, very happy to do that because these are things I'm trained for.
Sure,
So,
no, and I understand. I don't mean to cut you off, but I know colleagues probably have other questions. So I understand. I know you know your stuff, Dr. Sebastian. My concern is for this position that, so just a couple more questions. So there's an increase in TB and HIV in Brockton, but this isn't just to Brockton. I believe it's statewide, countrywide. I don't think this is just in Brockton that the increase.
Surprisingly, ma'am, when I analyzed the data for Massachusetts, it's disproportionately heavy on Brockton. And
how much?
It's
What's
something we need to
percentage?
invest. It's something we need to investigate.
Sure.
That a disproportionate amount of the cases of HIV
What's
as
a
well as
percentage?
TB.
What's a percentage rate?
13 cases of, as at the time I was doing the analysis, 13 cases of TB were found in Brockton alone. Brockton alone was the only double-digit city in Massachusetts.
So the only
Those
double-digit city?
those are concerning.
Okay,
Now,
so like
of all
how
the
much?
cities in Massachusetts, Brockton alone had 3 to 4% of the HIV cases. Of all the cities, there is no other city that had anything up to a single-digit case. They had cases in fractions, but Brockton had 3%.
Okay.
Other
So,
cities
once
had
again, I don't want to
0.
interrupt you, Doctor, but this is obviously something for another meeting that we bring up, why the numbers are high in Brockton and see what we can do about it. So lastly, so the majority of your work experience is outside of the U.S. Besides the Board of Health here in the U.S., have you worked anywhere else?
Yes.
I mean, here in Brockton?
When I relocated to the U.S. after working with the CDC for 10 years, I indicated I'd love to move on and relocate to the U.S., applied for my green card, and I was given and I relocated. So I'm a recent immigrant, yes. But within the time of my coming in here, I'd worked in the U.S. for about 4 years now. The first 2 years was with a contractor of the CDC. Coincidentally, it's by no specific design, a contractor of the CDC to support CDC protocols in 14 different countries. So I worked with the CDC supervising research that the CDC is doing in 14 different countries, primarily South Africa, Kenya, Uganda, Vietnam. So that I did until that contract ended. That contract ended because it was end of contract. And then thereafter, I joined the Board of Health.
Yeah, Brockton.
So, Board of Health in Brockton, and I've been with the Board of Health as a staff ever since.
Okay. So the mayor, when he was speaking, he brought up something very important, which I have been a huge part of, because we have businesses in the city that have lost, for one reason or another, that we've lost our tobacco licenses because, and it's causing a lot of issues with a lot of business owners. So is this something that you're prepared? Have you read up on it? Have you been, because this is a major thing that has been going on, and we haven't been able to have a Board of Health, a board meeting because we didn't have members. Is this something that you've looked up on, got yourself up to speed on? Because this is one of the, I didn't know we had, lawsuits against us because of pending lawsuits. So this is something that should be priority in this position. So is this something that you've gotten yourself educated on, sir?
Very true. It's something I already started updating myself with. You're correct.
You have?
Yes, I have.
Okay. I mean, I don't have any other questions. Once again, yes, your impressive resume. I was just hoping it was more stuff that was here and, that was more local. And in working at the Board of Health lastly, how did you work with the rest of the staff? How was your work with the rest of the staff at the Board of Health?
I would say very, very cordial.
Oh, very good. Okay.
Very cordial. Very cordial.
Okay. Very good. Thank you very much, Dr. Sebastian.
Thank you.
Thank you, Councilor. Councilor Lally.
Thank you, Mr. Chairman. Good evening.
Good evening.
I wanted to, I guess I had a couple questions for the mayor to start. Mr. Mayor.
A little time. I ran Falmouth yesterday, Councilor, so my quads are a little sore right now. So.
We won't time you today.
Don't, but I finished. 38 years in a row, so I finished. What do we got, Councilor?
Well, so I want to establish, when Councilor Azak was asking questions, the question of time as an employee of the Board of Health came up, and Dr. Sebastian said you'd worked there for about a year and a half. Is the job that Dr. Sebastian's leaving, the one that he held for a year and a half, does that have a residency requirement?
No, that does not, Councilor.
It does not.
I don't believe that does, not at all. And
Does
again,
this-
Go ahead.
Does the job he's going into, if appointed, have a residency requirement?
I believe it did, and I believe HR, I mean, I don't have it in front of me, but I mean, I want to be very honest about this. This was coordinated 100% through our human resources, and I have full faith in them. So again, the man was just asked, the doctor was just asked, and he indicated that he understands now that's within a year, and he would move to the city of Brockton, and we would welcome him.
Yeah, no,
But I don't have it in front of me, so I can't answer yes or no, but it's coordinated by HR, so I assume it would be.
Okay, thank you. Was this the doctor's already working? Was this something that the clerk of the council was notified as a temporary appointment?
Yeah, I mean, I'll work with a lot of departments. I don't think Attorney Resnick's here, and I know the solicitor's not here. She gave a letter to the council president. You know, if there was an error, there was an error, but it wasn't brought to my attention that there was an error on it. So I don't know if there was a thought that a home rule is different than a normal confirmation. But again, since this is finance, we have time to figure out what happened. If this is postponed or whatever, I would have HR come, law come, Dr. Montesir comes, because he was a direct report for Dr. Sebastian. I mean, that might be the easiest solution to get all the answers, but that's up to the will of the council.
Yeah, no, that's what kind of was tripping me up is, you know, I understand that from time to time, you know, things are time sensitive and, hey, quick, we got to move on this now, we got to act under suspension, things like that. But, you know, hiring somebody without a temporary appointment that has already started working, that's already getting paid before their appointment's actually confirmed is troubling for the council.
Okay. He started July 21st is what he just told me. So, again, there is a sense of urgency. It's not under suspension rules, but there is a sense of urgency since we don't have a Board of Health 3-member board anymore.
Right.
And we do have some serious issues that Councilor Izak just shared. And again, there's just, for the record, there are no lawsuits. We've just been put on notice by some law firms that they represent certain license holders or former tobacco license holders.
Yeah, my concern would be, you know, I know there is time-sensitive matters around this, but if there was no temporary appointment made or notification given to the body, then the body seems like it was circumvented slightly.
And that wasn't the intent, Council. If it was, I profusely apologize. I mean, I've worked with all of you. I served there for 14 years. All I can tell you is that this is a vitally important position that the governor ratified because she understood that this collective body, all 11 members, thought it was important. I think it's important. And that's the facts, and that's the truth. There's no try to hide anything. If the process wasn't done right, I apologize. Home rule position hasn't happened as long as I served. A home rule position signed by the governor to make a position in a city, to my knowledge, hasn't occurred since I've been here, and this is my 20th year.
Yeah. Well, that was a hang-up and a concern, so I will look forward to the clarity when that arrives. I have a lot of concern with that, but thank you, Mr. Mayor.
Thank you.
Dr. Sebastian, my first question to you is, you know, you've had 1.5 years experience working in the Board of Health. You're looking to transition to this new position. Across the spectrum of the departments and the roles that you would be overseeing, Board of Health, Human Resources, the Council on Aging, what do you consider to be the biggest challenges coming up, the things that feel like they're going to require the most focus?
They're working, as you just mentioned, working with the Board of Health for over 1.5 years, I've made a few observations about the city. If you would ask me which one would require, because there are quite a few places where we need to do something and we need to strengthen. So if I would rank it, the Human Services section will need some strengthening, as well as the Board of Health itself. The Board of Health, in the sense that the Board of Health seems to me to be under-resourced, if I'll be really honest. it's under-resourced. And what I notice is also as a public health specialist is that we're having reimagined diseases. Some of the diseases that we think are behind us, they are trickling back in, and we need a robust health infrastructure on ground to be able to be on the preventive side. So the Board of Health itself will need some strengthening. There are aspects of the human services sector that would need quite some strengthening too. For example, the survey we did showed us that the number one priority, the felt need, I will call it, of the residents of the city of Brockton are health initiatives in the direction of mental health services. To me, that was like a surprise, but Dr. Eno, whom I shared the data with, was not surprised. Now, another thing we noticed in that study, I noticed when I analyzed that study, was the leading identified deleterious behavior was also with regards to mental health issues, substance abuse, alcoholism, and violence. So those are issues that need attention. So as it is now, and we pray God that that doesn't happen, if there's a major epidemic, the city of Brockton is not well prepared infrastructure-wise to respond, because the Board of Health is sorely under-resourced, to be very honest. But on the other hand also, there are already issues that are staring us in the face that need substantial attention. The issue of substance abuse, the issue of behavioral health issues that are not concomitant with a healthy city, those need to be addressed also. Why will this need to be addressed? You need a healthy and a safe city to be attractive, to attract investment. Cities with violence, substance abuse, they do not attract investments in a city. So we can't ignore those aspects. Those will fall under human services, yes, but we need to do something urgently to clean up the city. Also is the issue of homelessness. I've noticed also that there are quite a few folks that don't seem to be appropriately housed. Now, these are interventions that need a lot of substantial funding. They are not very cheap. Housing is not cheap. Addressing behavioral issues are notoriously difficult because human behavior is difficult to change, so it requires resources and it requires intervention over a prolonged length. It requires patient, prolonged, and sustained intervention to make a breakthrough in any area that requires behavioral change, be it HIV, be it substance use, be it alcoholism, and all those three are in Brockton. Now, in terms of epidemics don't give you a foreknotice, so we really need to have a robust health infrastructure on ground that can be sufficiently responsive to curtail an epidemic. Presently, there are only 2 nurses that are working on HIV as well as COVID. We have 3 community health workers. This is good. It's something we can start with, but we really need to do something. And we pray that there won't be a major epidemic. Now, in terms of looking at it from stratifying it by population, one may say that these concerns are in the adult population, yes, but even among the under 5s, I've also noticed working in Board of Health that the immunization coverage is is suboptimal. It could be better. Before we have outbreaks in schools, we need to intervene on that. Already we are working on something to bring about immunization for all age groups, including children, including the homeless. So, if you stratify it by age, I think we really need to do something with regards to school health in ensuring optimal immunization coverage of all the different childhood vaccine preventable diseases. That's if you stratify it. If you do not stratify it by age, the issues of substance use seem to overshadow every other thing in terms of human services. And of course, it's already glaring that we need to strengthen the Board of Health to be sufficiently and robust enough so that it can sufficiently respond. Should we have anything like COVID again, we should be able to respond better than the previous time. So that is how we'll conclude it. There's not one area that can be ignored, but these are my three leading observations. Stratified by age, we need to do something about childhood immunization.
I know.
Among the adults, substance use disorder, behavioral change communications, and then strengthening the existing Board of Health to be robust and responsive to imagine and reimagine epidemics.
Thank you. I know that that's something, leads into my next remark, as you're talking about, how the department is underfunded. I know you intend, through your experience prior, to seek out a lot of grants. But, if the department does not receive a substantial change in funding, you are going to have to operate with what you've got.
Yes, we have to operate with what we got. One of the advantage of my working in CDC is that we have this concept of stretching the dollar, in which we try to make sure we maximize the utility that we get from every single dollar that the U.S. government funds into HIV intervention. You will recall that while I was talking about HIV, I said, yes, we substantially presented it that we are tackling HIV, but alongside we are also substantially strengthening the ministries of health, human capacity strengthening, because the skills you develop in tackling HIV, you can also use it in other areas. When we do construction and renovation, make facilities come alive, it also increases the utility because people feel there's this hog appeal. If you go to a facility, President Donald Trump made an analogy that if you go to a restaurant and the door handle is dirty, you can as well just walk back. You see, if you go to a facility and the facility itself looks like it's dying, it doesn't inspire confidence that you will get good health care in that facility. So though we were primarily tackling HIV, but we're also strengthening the infrastructure to be sufficiently strong in terms of human capacity and even the physical infrastructure to be sufficiently attractive and confidence inspiring so that people can go there and know that the test results will be a quality test, quality laboratory test. The facilities are conducive for you to endure the long waiting time to get to see a physician and all this. So the idea of building synergy and stretching the dollar, some of those skills are already inbuilt in me. So yes, I know that the funding we have is not, usually human needs are elastic while you have resources that are inelastic. So already I'm beginning to think of how we can use one stone to kill two birds. So yes, we're carrying out various interventions within the scope of what is available, but we will always seek to build synergy. And by doing that, I believe we can achieve more for every unit of dollar that is expended.
Thank you. The last thing that I'll have for you, Doctor, is, just assuming that you are appointed to the position, I would stress that, we have a lot of good people working in a lot of these departments that are going to sort of be under Health and Human Services, and people like the COA and HR, and they have a lot of experience. They have a lot of respect, in their profession. I would urge you to give them, to give them a lot of consideration and to trust their judgment with a lot of that. I have one more question or remark for the mayor, but given the mayor's recent
I can still get up, Council.
exertion, I'll look at him go.
It was exertion. Kind of
He knows he's got a couple months. He'll do it while he's got it. I would like to see, Mr. Mayor, there's a motion on the floor from my colleague to recommend this favorably. Whether it is recommended favorably or postponed or whatever is taken with this evening, I am hoping and I am expecting that in the time before this comes up next, be it a week or a month or whatever, that we get some additional clarification on a lot of the questions that we've had, that especially, again, even if Dr. Sebastian is appointed by this body in a week, that there be a communication on the desk of the clerk and on the agenda of the city council that the doctor has been temporarily appointed. Because if he's existing in limbo for another week and we haven't temporarily appointed him, that I would consider, based on the warning, that I would consider flaunting the role of the council.
No, and again, I apologize. It's not, I served up here. I respect all of you. You're the legislative body. I've always done that for the 5+ years I've been the mayor. So happy to do that. I'll work with Megan Bridges tomorrow or Karen Fisher tomorrow, just for belts and suspenders. But if, through the council president, however it pans out tonight, if there's no objection, let's just say it passed favorable and it goes to the full council for a vote. If nobody objects through you, Mr. President, I could have HR here to answer any additional questions. I could have Eno Montesir here in law department, but that would be up to your discretion.
Thank you, Mr. Mayor. Well, I guess I'll comment that when I have an opportunity to speak on this matter, so.
That's all I've got. Again, there should be a temporary appointment just to clear that and make sure we're operating appropriate legally. Thank you.
Thank you.
Thank you, Mr. Chairman.
Thank you, Councilor. Councilor Tavares.
Good evening, Mr. Doctor, and thank you for being here. Actually, I just have a couple questions. Like during the interview, I understand you're gonna be manage all those departments, like human service, agent service. Do you get chance to study those departments to see the implementation you need to be implemented on those departments? Do you understand it?
Sorry, ma'am, please, could you repeat the question? I'm not sure I heard some of what you were saying.
Okay, sorry. I said, I understand, your rules, basically you're going to be overseeing those departments.
Yes.
Do you have a chance to have a conversation with those departments to see what is the implementation you do need to implement?
Oh, yes, I do. Now, pleasantly, while we were doing the survey, that also gave us the opportunity to, because in the course of this 1.5 years I'd been working with the Board of Health, I'd interacted with Council on Aging, I'd interacted in the Brockton Health Authority, I've interacted with even some on a one-on-one basis, I've interacted with some of the inspectors. Yes, and I also do intend to build bridges. In building bridges, I would seek to understand the successes and the challenges so far, as well as the immediate goals and visions of those different agencies. My role, therefore, would be to help them in achieving those goals, as I said earlier, by building synergy, even collaboratively with other agencies within the Department of Health. So yes, I intend to. It's already ongoing and it will continue because I've actually started it, I've actually experienced it, I've interacted with them, but to go deeper so that I begin to understand immediately and much better what their challenges are, where it hurts, what is the limitations they are facing, and together we'll put our minds together. My responsibility will be to see to it that they overcome those challenges so that we can together achieve more. That definitely is the modus I intend to operate by, collaborative, synergistic working.
All right. Has you been work with the Board of Health for 1 year? And based during your research, what do you think about code enforcement? Do you think, like, you're going to take any action for any implementation? Or what do you think with that, code enforcement?
What do I think about what, please?
Code enforcement
Code enforcement.
and the building department, yes.
Oh, yes, one of the aspects of code enforcement, yes, definitely, we have to, because the laws were designed to help promote healthy cities. There are sanitary laws and codes to promote healthy housing, to promote safe business environment, to promote safe, especially with regards to food safety. But one of the things I intend to do is to also promote health communication and education, because I would not want the residents of the city to see enforcers with an adversarial perspective or through an adversarial lens. We are not adversaries. We're actually working for the good of all. So sufficient health communication to members and residents in the city to understand the objectives and our common goal, so that our actions, our enforcement actions, are not seen from an adversarial perspective. That's one of the major things I intend to do once I come on board. So improve health communication and health education of the city. We have already started that in the Board of Health. For example, we've done using the Brockton access. We've done some communication videos. We've done one on TB. We've done one on HIV. We've done one on alcoholism. We're planning one on diabetes. So from this education, people will begin to see why we enforce certain things that we enforce, so that the residents of the city will not see enforcement from an adversarial perspective, but rather, because when people are sufficiently health and appropriately health informed, they will take the responsibility to initiate certain actions for the collective good, for both their own personal and collective good, even without an enforcer breathing down their backs. But of course, enforcement is necessary, because if you leave people to it, standards may not be observed as we will want it to be. Efforts may be taken but may not measure up to the appropriate standards. So the purpose of the enforcement, therefore, will be to encourage residents to come up to our mutually desired standards.
All right. Do you have any chance or opportunity to have sit with all those employees to understand or learn from them, things need to get done or implementation need to get implemented? Do you have those opportunity?
Because I'm just assuming this role, I have not sat with people from other agencies. I've just been here 2 or 3 weeks. Mm-hmm. But prior to now, within the Board of Health, we've had meetings on one-on-one basis or at times when, for example, when there was this period when we were doing health outreaches to the different agencies, those also gave me opportunity to interact with them, but not on a formal basis as the Commissioner of Health and Human Services coming to understand what your needs are, where your challenges are. No. But prior to now, on one-on-one basis, while we're doing this survey, while we're doing health outreaches, while there was also the study we did on the prevalence of high blood pressure and chronic diseases, it also gave us opportunity to take their blood pressure, measure, educate, then, interact. And from those interactions, you begin to build bridges, networks, understand what their needs are. So I did those personally for all the periods of time when we were doing some of these health outreaches to the Brockton Housing Authority, to the Council on Aging. We did a number of those. But to sit together as a collective in a formal forum, I've not done that. I've just been only 2 weeks, a little more than 2 weeks on this job.
Actually, I'd like to advise you that is important as a new position, just take it. It's important to sit with them, to have a conversation and learn from them and try to see what the needs are. Then that case will make you understand the way you can put those work together easier for them as well.
Absolutely.
Yes. All right. That's all I have for you. And thank you so much.
Thank you, Councilor. Councilor Davenport.
Thank you, Mr. Chairman. Good evening, Dr. Sebastian. Listen, man, I just want to thank you for actually, taking the time not only to apply for this job, but also having the willingness to come to the city of Brockton to work for us. And, since I've been on this council, I have never seen, and I voted on a lot of appointment in here, I have never seen somebody with that level of qualification, ever. Your willingness to come to the city to work and your desire to succeed is what we need here. And earlier you stated that you would like to work in collaboration. And collaboration is something that we don't really see in this community, and which is something that I'm hoping to see. And by virtue of you stated your willingness not only to come here and live, but also to work in collaboration with different partners, it's something that is expired. For me, I guess you may not have the political connection in terms of having access to appointments. However, you do have the qualification, which is a lot of people do not. And in my view, in terms of residency, I am one of those up here that are very tough when it's come down for people to have jobs, but also willing to work here. You are willing not only to work, but also to live. And at the end of the day, this is something that I need. It's unfortunate to see that, I don't believe you were prepared to answer all this question, and you did pretty well. To have a PhD and also an MD is not a gift. You have to earn it. And obviously, by virtue of you acknowledging your work with CDC, it's something that is impressive. Not anybody can work with CDC. Not anybody can be in a supervising role with CDC. Therefore, not only you have the qualification, but you have the experience to do that. And for some of my colleagues who may not know anything about diseases, it doesn't have a place. It's all over the world. COVID justified that. And just because somebody works outside of this country does not mean they are unqualified, incompetent, or unaware. You stated that you work in South Africa, Nigeria. And when it's come down to diseases, we do go outside of this world to try to understand the complexity of what's going on. By virtue of our community and, of course, the diversity that we are dealing with, it is not shocking to me to hear that some of the issues that we are facing are probably in double J just in Brockton. So I just want to encourage you to continue doing what you're doing in here. And obviously, it will not be easy. As a new position, you're going to have to create your own way if you get appointed. But what I can guarantee you is that you will get my vote. I am 100% in favor of your appointment. And I will do whatever I can to making sure that we vote on it. Because sometimes it is very easy for those of us who are elected, to sit up here and ask questions just because we can't. But in terms of the explanation that you are giving, and I'll be honest with you, most of them, I have no clue of what you're talking about because I'm not a doctor and I'm not in the medical field. And I don't believe I expect you to explain to me, more than 15 years within that field in a couple hours. So I hope you don't get discouraged. I hope you don't call the mayor and tell him that you are not coming to Brockton anymore. And I hope that you take this evening as a learning curve to understand the complexity of what's going on in politics and the folks that you're going to have to deal with. And I can guarantee you is that this will not, if you are appointed your last meeting, you will get called in this chamber to give explanation to stuff that is going on within your departments. And in terms of working in collaboration with different departments, I believe you can do it. I listen to you carefully, even though I don't fully understand some of the explanation that you give, given the fact that I am uneducated about your field. But I see your willingness to share information to people. And I'm pretty positive that this community will benefit very strongly in regard to your knowledge. And I know Dr. Modesi very well, and I know how passionate he is about not just working for Brockton, but helping and bringing the best of this community. If there is one thing that I've learned, COVID was a wake-up call in terms of what can happen and what might happen. I understand that our departments are underfunding. We have a responsibility to create an environment whereby our residents feel comfortable and business people are able to come down here and invest money. You stated that the unhoused population, and you come up with an analogy. If you are going to a restaurant and you see that the door, this is not exactly what you said, but along those lines, the door are dirty, the table are dirty, it's not a welcoming place to sit down and eat. And it somewhat shows a level of carelessness in regard to healthcare. Because if you are in a business of serving people, the table should be clean. The plate you are serving should be clean. And for me, you could not explain yourself more. You could not justify why you should be the commissioner. You could not say anything about residency. I sit up here listening to people adamantly saying that they will not move to Brockton. You are willingly saying that you are more than welcome to come here. And I would encourage you to do so. So at least some of us can see that it was not just word. And I also sat up here seeing some of my colleagues voted in favor of giving something called waiver to people who do not want to be here. And it's not shocking to me because the moment might be different, and as some of my colleagues stated, why now? I think now is the moment, because I think we have to see this tonight. I think, Mr. Chairman, you would like to speak before I made my motions. I will speak once he's done, to see where we go from there. Thank you, Mr. Chairman. Thank you, Mr. Chairman.
Thank you, Councilor.
Councilor Thompson?
To the chairman, sir, if you may permit me, I just want to make a closing remark before you speak.
No, hold on. He's going to speak before.
Oh, okay.
Yes. Thank you, Mr. Chairman, and good evening, Doctor. It's a pleasure to meet you. The position in which you're being hired for as Director of the Commissioner of Health and Human Services, the
this whole ordinance and this whole department was a city council initiated process. I think maybe we debated and discussed this department for over a year. It was before us multiple times in front of the Ordinance Committee and multiple times where us councilors discussed our vision for this department. And in those discussions and those debates, I think when we were looking at who would lead this department, I think our vision was someone that had a broad experience and that had familiarity with our community. And so that being said, as the confirming board on this position, I'm just wondering why there wasn't like any more outreach or any more lobbying to the people who are going to decide on this position or not. This is, essentially the first time I've met you, sir. And, Mr. Mayor, you've nominated Dr. Sebastian for this position. There was no conversation, no outreach, we hold a lot of power here in this decision-making process, and I just don't. There was really no outreach to this committee or to this council to get to know you, to talk with you, to talk about your experience and your background and all of that. And so, I think that should have been an important part of this process. You will be, if appointed, one of the highest paid employees in the city of Brockton. And the fact that, I think for many of us, this might be the first time we've had a conversation with you, sir. And, I just, because this was a city council initiated process that we debated for over a year, to now make a decision tonight on the first conversation with you, I just find that puts us in a real difficult position, because this is a position I would have liked to chew on a little while, get to know you, sit down with you, have a conversation with you, speak with other members of, since you've been a member of the Board of Health and now an acting position for a month, excuse me, what's the feedback from the people that you're going to lead? And so that's number one. This process, people say it's rushed, and it may not be rushed in the way that we need the position filled, but definitely this is our guy, vote on him now. I just don't kind of like the proverbial gun to the head type of situation. So I do have issue with that. So I also, when we were discussing kind of who would head this, we kind of were more specific, and I think we said it often, and Councilor Rodriguez may be able to, confirm this, but we said we don't need another director of Board of Health, right? Like, it feels like this, and you have an extended experience in epidemiology and in CDC, and those are tremendous skills. But it seems like, that your experience and background is more suited for, let's say, the director of Board of Health, and not maybe potentially what we envisioned as a public administrator or a public health administrator or manager for an overarching department. And so that's why I wanted to have maybe an opportunity to have a longer discussion with you in your experience and background, and maybe even speak to our HR department. What was the vetting process? Because for everyone's knowledge, this ordinance does not have a residency requirement, but it does have a residency preference. So how did that play into the decision-making process? So those are some of my concerns. One last thing is, looking at your background, sir, a doctor, you have extensive experience and degrees, it looks like, from overseas. You said that you are a medical doctor. Is that a U.S. board certified physician?
No, I'm not U.S. trained. I'm internationally trained.
Right.
So I'm a medical doctor. I have a degree in medicine. I practiced for 10 years as a clinician, and then I further specialized as a public health physician for another 6 years of residency, concluding of which I got a fellowship in public health. So I have an MD, I have a master's in public health, I have a fellowship in public health. A fellowship in public health is equivalent to a professional doctorate in public health.
So your doctor certification is PhD and not
No,
U.S.
my
board
doctor's
certified
certification,
medical doctor?
MD. I'm a doctor of medicine first. Thereafter, I specialized in public health, and I attained a fellowship in public health, which is equivalent to a professional doctorate in public health. And in addition, I also have a master's in public health. I have a doctor's degree as a doctor. Perform surgeries, treat patients, take deliveries, family practice, everything. But I chose to specialize in public health and community medicine.
But are you certified to practice medicine in the United States, like a medical doctor?
No, I'm not required to certify for if I want to pursue the line of public health. But if I want to pursue the line of clinical medicine, in which I would see patients, perform surgeries, or take deliveries, or practice as a family physician, then I'll need a local license to do that.
Okay, understood. I just wanted to clarify that. And then just lastly, the discussion about the tobacco issue. I just want a clarification. If appointed, then we can resolve that matter, or do we still require the advisory board to be in place for the tobacco issue to be resolved? I don't know, Mr. Mayor, is that how it goes? Because this ordinance also requires that advisory board. So are those decisions able to be made without the advisory board?
No, it's a 9-member board under the auspices defined by this committee, but 2 have to be medical doctors. So what we've already discussed with the law department, and we discussed with the VA and Good Sam, I spoke to Matt Hesketh, BMC South, and also Bob Haffey, is to try to get the 2 MDs up front. If we can't, we still have to get other members, but there are parameters on what they are. But the goal right now is to at least get enough members to be a quorum so we can start rolling on those tobaccos. And
Now,
then ultimately get the full complement of 9.
Does the Commissioner of Health and Human Services need to be appointed first, or do let's say there is no, let's say for some reason this matter does not pass. Are we tracking on the advisory board, or are they able to make those decisions within the existing structure of that department?
It's a good question,
or does
Councilor.
it require...
I don't know. I'd have to ask law, because I guess you could argue it both ways. Number one, if there's no commissioner in place, there should not be a commission of 9 members. But you could also say it was already executed by the governor, so it's lawful. So I don't know, but I can check with the solicitor in the morning. But I am telling you that we're working simultaneously right now to try to get some members that meet the criteria defined by this body.
Well, that'd be important, because that issue is providing some of the impetus to move this process forward. And so if that pressure is not dependent upon this appointment, then that's something that this body should know.
Yeah, I mean, regardless, I'm going to do what Mr. Lally asked me to do and do a letter tomorrow for a 30-day interim, just for belts and suspenders. And then that's within the realm of the mayor, right? Then that would allow us, if the answer is you have to have someone, we'll have them in place anyhow by that letter, and then we could get the membership. I don't know, and maybe Moses, Councilor, you may know, do they have to be confirmed by this body? The membership?
They do.
The membership does?
They do.
Okay. And again, I had said this before, and again, this is not intentional by any ways. I mean, the only other home rule position that I can think of, again, it hasn't happened in 20 years that I know of, the only one I can think of is the CFO position, which was a home rule position set up and signed by the governor, but it's appointed by and confirmed by the mayor, and then it's just a letter that's read and placed on file by this body. Again, that's the only thing I can think of that'd be similar in scope, but I'll get an answer from legal about if we can do it regardless to get the membership completed.
And just anecdotally, on the issue of outreach, I think we could have done a better job on that, Mr. Mayor,
For me?
for presenting Dr. Sebastian to this body, letting us know, making him available. Honestly, I was unaware of this appointment until the agenda came out. Once it came out, that was the first I knew about it. And so, this being a collaborative effort with this council being the initiator of this department, I just wish there was a little more outreach to us in the confirmation process.
Duly noted, but it also, regardless of how it happens tonight, it also gives Dr. Sebastian his ability to reach out to all 11 members to sit down individually as well. Even if it was confirmed tonight and passed favorably, it would still give him his time to meet with all of you. But I hear what you're saying, Councilor.
Okay. Thank you, Mr. Mayor. And thank you, Doctor. I appreciate you stepping forward and, looking to serve our community. I just, thank you for that, Doctor.
Thank you very much. Thank you very much, sir.
Thank you, Mr. Chair.
I would
And
just
please,
want to provide a little bit of some insight to you regarding some of your observations. You will all agree with me that when we respond to a job vacancy or an opening, we usually are saddled with curtailing your CV to meet what is required for the position. So sometimes you may not really be able to bring out all your experience. So when you talk about the issue of the administrative responsibilities, I want to assure you that I am extensively experienced in that. You have no worries at all, both managerial and administrative responsibilities. In responding to the councillor, I'd already emphasized the aspects of managerial responsibility, grant management, and all those. But in terms of the aspects of administration, those are also there. Because while I worked with the CDC, it gave me the opportunity to be skilled in public health diplomacy. You understand with me that working in the CDC, I was seen as U.S. government, and I had to interact with host country governments at national level, at state level, Ministry of Health officials, commissioners, directors of the different departments, especially within the HIV and the TB aspects of the healthcare, but also, as I had mentioned earlier, the commissioner himself, because we needed to do some kind of health strengthening, which was like a sub-agenda of the main agenda of HIV. So these exposures granted me extensive across-the-board working. So it built up my skills in all these administrative things extensively. But also, working in the CDC within the U.S. Embassy, you might not know this, but the U.S. Embassy is you should know this, I believe. The U.S. Embassy itself is a representation of the U.S. government. So all the different agencies you have, the CDC, the USAID, FBI, CIA, you'll be surprised they are all present in the U.S. Embassy. So I had to work in. Okay, you would all know what PEPFAR is. Within PEPFAR, you have the U.S. CDC, the USAID, U.S. Agency for International Development, that's what I mean by USAID. And then also you have the Department of Defense. So the Department of Defense has its own technical staff. We have our own technical staff in the U.S. CDC. So within the U.S. Embassy, we had to even collaborate and work across the board amongst ourselves. So it has given me the opportunity to be skilled in the non-core medicine issues. These are not disease, these are not epidemiology. Yes, I have my expertise in disease and epidemiology, but I have my expertise in networking and building relationships, because I have to build relationships and build synergy within the US team, and we have to build synergy across intergovernmental relationships. And also it gave me opportunity to work with the WHO. We work extensively with the WHO. It's a thing of pride that the US CDC is actually is the brain behind most of the things WHO does. That's the truth. We are the real brain behind. The WHO is more of the political, we are the technical experts, but we do develop that relationship. So develop relationship working with USAID, develop relationship working with Department of Defense, develop relationship working with WHO, develop relationship working with across governments at different levels, the national government, the subnational levels, and even the local government level. So there is a lot other than medicine, science, disease, jam. There's a lot of social skills, communication, networking skills. There's a lot of all those other skills that have come in. And I wasn't in the CDC for 1 or 2 years. I was in the CDC for 10 years.
Thank you, Doctor.
Mr. Chairman.
Councilor Farwell.
Just a point of inquiry to my colleague, Councilor Durenencourt. If he would withdraw his motion to act favorably, and the second is
Where's the motion yet?
withdrawn.
Yeah, that was the first thing.
Did he make the
Sorry,
motion? Oh,
Mr.
he did,
Clerk.
okay.
Yeah, we have a motion on the floor.
If that happens, then I have a suggestion relative to this matter. But first, we'd have to withdraw the motion to recommend favorably.
Councilor Davenport.
Yeah, Mr. Mayor, let me ask you a question really quick, if you don't mind. It should be short. Yeah.
Councilor.
Yes, earlier you stated that this particular position does not require a doctor.
It's not
Right.
required, an MD,
Pretty
correct?
much, right? So by virtue of the knowledge that you have in the city, and of course, given the situation that we had with COVID, I'm assuming it was your preference
Yes.
to have somebody
Yes.
with this kind of knowledge.
Absolutely.
And because of that, in your view, and based on his knowledge, Dr. Sebastian knowledge, you believe that he was the best fit for the job.
Yes.
That's why you brought him.
Yes.
So technically, you have no reason whatsoever to pick a doctor. You could have picked anybody. But given the fact that you've been the mayor for about 6 years now, you understand to be a doctor, obviously, requires extensive training, and you would trust somebody with that level of knowledge in a situation like this. I'm pretty positive this was your reasoning behind that decision, which I think was effective in terms of like the outcome that we are expecting here.
Yeah, Council, all I can tell you is I stand by this appointment, but I also know that dealing with Dr. Rick Herman, MD, who was our medical consultant during the pandemic and thereafter, to have a doctor associated with the city of Brockton is a godsend during pandemics and without. And the HIV thing is scary because, again, based upon the Commonwealth of Massachusetts, Brockton has the highest rate right now. That's crazy in the year 2025. We have to figure out what's the catalyst for that. So even though the doctor has an international MD, he's medically trained. He's a physician, and I think that brings a lot of value.
So, Mayor, earlier I acknowledged that. I mean, especially when it's come down to diseases, I mean, it's important to have an international mindset, and especially to the place where Dr. Sebastian was trained. And in my view, you know, he's what I'm afraid of. To talk about HIV, to talk about different diseases, it is important to have somebody who has knowledge on that field. Yes, you can hire anybody that you want, but when you have somebody who has experience, who's been there and done it, who understands the complexity of the diversity that we are dealing with, in my view, I think it's a no-brainer. However, I am one vote up here. And what I can tell you, as always, I will vote in favor of this whenever that comes in front of me. But for the sake of Dr. Sebastian, and of course to some of my colleagues' acknowledgement, what I will do, I will withdraw my motion to take a vote on this tonight, and I will make another motion to postpone this. And obviously, we can debate on when we want that. But first, I would like to make a motion to remove my motion.
Councilor Rodriguez, would you remove the second, on that motion?
Yeah, I'll remove the second.
And then,
The motion to recommend favorably has been withdrawn. Councilor Darrencourt.
and I would like to make a motion to postpone this. And now the question is, how far do we want to postpone that? That would be up to all of us.
Well, I think it would be appropriate to the next Finance Committee meeting.
Mr. Mayor, would that be appropriate? Would that be enough time for you?
Yes, I'm going to do a 30-day interim appointment tomorrow. Again, 30 days, if the confirmation happened before 30 days, the letter becomes void. But I just want to share one other thing. As you know, we have a grant through DPH that another neighboring community gave up. And so the city of Brockton now, and thank you to you all, you set up a revolving account, and so that we're going to be doing vaccines with other municipalities. And one of those is important in Brockton. And Doctor has talked to me about this. We're having a lot of new arrivals to the city of Brockton that the kids have not had a vaccine, an MMR, they've never had it. So you cannot be enrolled in public schools in the Commonwealth of Massachusetts without vaccines. So doctor's an expert in that. We also talked about anybody over 50 plus, shingle shot. So there's going to be a lot of vaccines being done as well. I know we talked about TB and HIV tonight, but the simple vaccines that people don't have, the polio vaccine, there's a lot of people in Brockton don't have that right now. So doctors not just working on that. Triple E is real. West Nile is real. Triple E was in a mosquito in a neighboring community just the other day. So I will do the letter at the request of Councilor Lally. I will also honor the request of the council president. There'll be lobbying done. Dr. Monteser, I'll ask him to call of you as well, since he was his direct report. But again, when you have someone, the CDC just doesn't hire any willy-nilly. So the fact that this gentleman was hired by the CDC, I think, speaks volumes. Thank you, Councilor.
Mr. Chairman, so like the next meeting, hold on.
Councilor, a motion is on the table.
I just want to figure out, because I just don't want to vote on it and not having enough time. He's seconded it, but Mr. Mayor.
It has not yet been seconded. So
Motion.
at that point,
Motion made and seconded.
okay.
Okay, excellent. So, Mr. Mayor, so you believe that the next finance meeting will be enough for you to work with your partners in terms of the people that you would like to invite to come up here? Because
I mean, tonight was enough for me, but I will say this. The next one would be, what's the date certain on that? I don't know.
Second week in
Mr. Clerk.
September.
First Monday.
Second.
We're back. Yeah, we're back
That's
on.
right, right, first.
We're back on regular schedule.
First and third.
That's a holiday, though, so that'd be the Tuesday, right?
And it should be Tuesday, September 2nd.
Tuesday, September 2nd.
So, Mr. Mayor, that would be okay?
Yes.
One day after the holiday?
Yes.
Okay, so that's fine with me.
Motion was made, properly seconded, to postpone this matter. All in favor?
On the motion,
Just quickly, please.
I understand, but I would like to have the interview committee here, Sandra Knight and the people who interviewed this gentleman. I want to know what they found in his background that was so compelling that he was the very best candidate chosen. Because it doesn't matter whether you worked for the CDC, it matters whether you can plan, organize, direct, inspire, and lead people to get the work done. And he's just been through an inquisition here. And it's not the way to get to know a candidate. And so I would like to have those three people here at the next FinCom so we can find out, what did you ask him? What were the responses that compelled you to say, this gentleman is the best candidate? Thank you, Mr. Chairman.
Okay, thank you, Councilor. Motion was made, properly seconded. All in favor for postponement? Anyone opposed? Matters postponed. Thank you, Doctor. Thank you, Mr. Mayor, for joining us.
Thank you.
Item number 3, order that the City Council authorizes the acceptance and expenditure of the total grant funds in the amount of $50,000 from the Massachusetts Department of Mental Health to the Brockton Police Department. Invited Police Chief Brenda Perez or her designee, CFO Dr. Troy Clarkson. We did hear from the chief. She was unable to be here, but has sent Sergeant Skinner to attend for her.
Sergeant Skinner, good evening.
Good evening, everyone.
Dr. Clarkson, good evening, sir.
Evening.
Floor is yours, gentlemen.
All right, so tonight, I'm respectfully asking the council to accept a $50,000 jail diversion grant offered by the Department of Mental Health. This grant helps us fund a co-response model that consists of a police officer and a mental health clinician. Currently, we have one full-time clinician and one part-time clinician. We've had this co-response model for several years now, and it's a great success. I've personally witnessed how the clinician has de-escalated situations, offered the appropriate services for the person in crisis. So, again, very successful, and we're hoping we can continue this.
Motion to recommend favorably back to the full city council.
Second.
Dr. Clarkson, anything to add before we vote, or?
No, I provided a similar update to you in my regular memo, and I think the sergeant has been eloquent and detailed in his description.
Thank you. Motion is made, properly seconded. I recommend this matter favorably. All in favor? Anyone opposed? Matters recommended favorably.
Thank you.
Thank you, Sergeant. Pleasure you joining us this evening.
Item 4, ordered that the City Council authorize the acceptance and expenditure of the total grant funds in the amount of $125,000 from the Massachusetts Department of Public Health to the Mayor's Office. Invited Honorable Mayor Robert Sullivan or his designee and CFO Dr. Troy Clarkson.
Dr. Clarkson.
Thank you, Mr. Chairman. As I did mention in my memo, and I'm just looking at those notes, the grant is a continuation of the Massachusetts Collaboration for Action, Leadership, and Learning, also known as the Mass Call 3 program. It's a substance use prevention program. I did provide you a link to a press release from when this originally was brought to the city several years ago, and this is just a continuation of that work.
Motion to recommend favorably back to the full city council.
Second.
Motion is made, properly seconded to recommend this matter favorably. All in favor? Anyone opposed? Matters recommended favorably. Thank you, Dr. Clarkson.
Item 5, ordered that the mayor be and is hereby is authorized to execute the following easements attached here to as Exhibits 1 and 2 concerning the property located on the easterly side of Center Street in Pembroke, Massachusetts. Exhibit 1, easement from the City of Brockton to Gary Darman and Patricia L. Darman, husband and wife, as tenants by the entirety of 792 Center Street, Pembroke, 10 pages, including legal descriptions. And Exhibit 2, easement from the City of Brockton to Lester G. Freeman and Denise Freeman as joint tenants of 794 Center Street, Pembroke, Mass., 9 pages, including legal descriptions. Invited City Solicitor Megan Bridges and/or her designee, CFO Dr. Troy Clarkson.
Mr. Chairman, I know you have a letter from the solicitor. She's on vacation this week. In essence, what this is clearing up title issue in Pembroke, but there is a letter that the solicitor provided to you.
That's correct. I was unable to forward that letter to all the other city councilors. My phone died. It was done after hours, so I don't know if everybody received it. But essentially, Solicitor Bridges states the same as the mayor, that this was actually a matter voted on by a previous council to approve this easement. It was never recorded. Here we are about 25 years later, and just to kind of clean up some paperwork, the recording attorney requested another vote by this council to kind of ripen the issue for recording. So those are essentially the facts regarding this matter. If anybody has a question, Councilor
Great if you'd send it to us after tonight.
She did.
If you would send us the letter after tonight.
Yes, I'll send it first thing in the morning.
Okay, I've read the documents that were provided to us in the packet. The easement number 1 that's going to the Darmans, it's just an easement in a right-of-way. And easement number 2 is a drainage easement. It's not a big deal, really isn't. We own a great swath of land that runs from Silver Lake to the city of Brockton, and so this is just on the edge of it. I think it looks fine, and I did sponsor this. Thank you.
Thank you, Councilor. Councilor Rodriguez.
Thank you, Mr. Chairman. Mr. Mayor, quick question for you. We are aware of some hoopla that's taking place up in the state office at Beacon Hill with regards to Silver Lake and the taking of water, not taking of water. It's clear based on even the asking of an easement, that we are the owners of that lake. We are the owners of the property surrounding that lake, correct?
Yeah, I mean, I wholeheartedly do not support or endorse Representative Lenatra, who is not a Brockton representative's filing. It doesn't make any sense, practical or legal sense. However, what this is, Council, yeah, this is just clearing up something that for 25 years wasn't recorded, but the city of Brockton has lawful legal rights to utilize Silver Lake. We own lawful land that abuts Silver Lake, a ton of land, and I concur with Councilor Nacastro, but that bill that is up there on Beacon Hill is not a good bill for the city of Brockton.
But since we are the owners of the land, I think it's easy to basically realize that I think, and I know, Mr. Chairman, we're a little off topic because that's not what we're discussing here today, but since it does mention Silver Lake, I think it's appropriate for us to talk about it a little bit to a point where if we even have to preempt some sort of an injunction against that action, I think we need to do that because I think it's important for us to stake claim to the fact that we own the land where the lake is located. It's like you owning a home and somebody coming in from the outside saying, well, you got to paint your room this color, do this, do that, do this, and do that with your own house. And I think since we do own the land, we own the lake, I don't think a community or even some members of the legislature can actually come to us and dictate what we can do with the land that we duly own in the town of Pembroke. Because Brockton is Brockton plus Pembroke. And I think it's important for people to realize that. And I think we, as a government in the sense, owe it to the rest of us residents of this city, or to the residents of this city, to basically take some preemptive measures in the sense to put this thing to rest, because you never know. You know, some crazier things have happened in D.C. and some of the other places. Things can change at Beacon Hill, and before you know it, we're going to be told that we can't even use the land that we own or use the water that we own. So I think it's important for us to take those preempted strikes in a sense.
Yeah, Councilor, you and I agree on this, and I know former Councilor State Rep Dubois is adamantly against this as well. I believe the state delegation is as well. I mean, my whole thing is, it came out of a subcommittee. It's still lingering on Beacon Hill. It impacts Brockton, taxpayers and residents, business owners. We are doing letters of opposition right now. I just got one from Fire Chief Brian Nardelli. I'm going to author one. I would love to get one from the council as a whole as well. And then I think it's power in numbers. I think we go up to Beacon Hill and we talk to the people up there, because this is impacting potentially a lot of Brockton residents and business owners, and it's just not a good bill. It's not a good bill.
No, but I think we need to take legal action.
Well, we don't have a standing to take legal action because nothing's been passed. It just came out of a subcommittee, so nothing's been ratified up in Beacon Hill. It may linger there. It may go to House Ways and Means, and then if it comes out of the House favorable, then it has to go to the Senate side. So I don't think we'd have any standing to file anything right now. We have to track it. We have to monitor it. But I think our power is in our voices.
I think in the letters that we write,
yes,
it basically clearly stated in that letter that that's what we intend to do. We're not going to sit here.
I agree with you, Councilor. Yeah, I agree.
Deprive the residents of this city of water that is truly and legally ours.
Right, and I think doing a collective letter with the city council and the mayor on one letter, and we can hand deliver it up there. Working with Attorney Resnick on behalf of the city council, Attorney Bridges on I support it 100%. I think we need to do it ASAP.
Okay.
Because you and I and none of the members here were notified that there was a hearing in Boston. Because if we had been notified there was a hearing in Boston, we all would have went in to testify in opposition. But it wasn't told to us, which is pretty lousy politics.
Right. And I agree, and Mr. President, I would recommend to this body that we do that as soon as possible, because we're being asked to give away a piece of our land. And then we've got lawmakers out there working against us to basically take away our right to water. Never mind just the land, but our right to water, and dictating how much water we can take, how much water we do not we're not allowed to take out of that lake. So I think it's important for us to band together and do this as one.
No, absolutely agree, Councilor. It's a terrible legislation, and I think after those letters are drawn up, I think maybe we could file a resolve to bring the city parties before us, discuss the legislation, make the public aware what Beacon Hill is up to, and then that way we can unanimously vote, I hope, to transmit that letter to Beacon Hill. So that is a matter that will be coming before us shortly. Thank you, Mr. Mayor.
Thank you.
Have we made a vote?
We have a motion on this, correct?
Oh.
No, we need a,
Councilors, I'd entertain a motion on the agenda matter before us.
Motion to recommend favorably
Second.
back to the full city council.
Motion is made and properly seconded to recommend this order favorably. All in favor? Anyone opposed? The order is recommended favorable. Number 6.
Item 6, order that the City Council of the City of Brockton petitions the Great and General Court to repeal special legislation relating to the City of Brockton, to be filed with an attested copy of this order, be and hereby as approved under the provisions of Clause 1, Section 8 of Article 2 as amended of the Articles of Amendments to the Constitution of the Commonwealth of Massachusetts as follows.
Mr. Chairman, I'd ask to waive the reading of this. It's printed on the agenda. I filed this, and I will only need a few minutes this evening. So.
It is a multi-page agenda item, councilors. Motion has been made to waive. Can I get a second?
Second.
Motion has been made and properly seconded to waive the reading. All in favor? Anyone opposed? Motion passes.
Thank you, Councilor.
All right, Mr. Chairman, if I could very quickly, Chapter 324 of the Acts of 1990 was passed. It created the Finance Department for the City of Brockton, created the position of Chief Financial Officer, and it outlined several requirements that the city should take with respect to its financial management and internal financial controls. Very interestingly today, I had a conversation with John Condon, who was our Chief Financial Officer for over 30 years. I had the conversation with him because, as you know, and I've talked about it before, a couple of issues came up with respect to the schools. One was, and I've given you some handouts, one was the approval of a school police contract involving tens of thousands of dollars in raises for people, and there was no involvement by the Chief Financial Officer to cost that, certify it, or otherwise approve it. And in fact, Mr. Clarkson on September 16th, 2024, sent an email to the school department cautioning them about that contract, saying we need to talk about this, this is not proper. Next we have Mr. Condon telling me that when Chapter 324 of the Acts of 1990 passed, he always certified every order that had a financial implication for more than a year's duration. He did that under Superintendent Beige, Superintendent Matt George, Superintendent Nemberkow, Superintendent Smith. Somehow we got away from that. So we ended up with, unfortunately, a crisis with an $18 million deficit. Plenty of people at fault. I don't absolve the mayor and I don't absolve the CFO. The Nystrom-Beckman report clearly outlined the deficiencies that they thought existed. And the next document that I provided for you is page 154 and 155 out of the Nystrom-Beckman report. And on these pages you will find out that they clearly document Chapter 324 requires the certification and review by the Chief Financial Officer of any contract in excess of one year, which has a financial obligation. And it also mentions on page 155 that in 2012, the City commissioned the Department of Revenue to do a financial management review of the city, and they recommended, quote, appointing the Executive Director of School Financial Services as the Assistant CFO. If the Executive Director and School Committee are amenable to this expanded role, this option has the potential to further strengthen and integrate the two financial operations and could potentially lead to the additional consolidation of functions. Example, procurement, payroll, and accounts payable. So we do not have legislative counsel tonight. We do not have Megan Bridges. I'd like you to read these documents, and what I would propose, because this is now a legal issue. This isn't a policy issue about whether we should or shouldn't do this. Chapter 324 of the Acts of 1990 is a law that is in effect. And what I would suggest is that we have Dr. Clarkson, the mayor as chairman of the school committee, and Priya Tahiliani as the superintendent come in to the next FinCom meeting. Let's talk about the financial requirements of Chapter 324, and if the schools agree to follow the law, and I do believe she will do that. I am now a solid supporter of the school superintendent. I think she wants to see the best interests of the city move forward. I think she is absolutely committed to seeing the school operated in a very cost-efficient and effective manner to provide services. I do not believe that she is going to say, no, we're going to disregard Chapter 324. I think she will follow the law, and I think given the degree of collaboration and cooperation that we've had during the past year, which Dr. Clarkson and/or the mayor can speak about, I foresee great things. So my recommendation, unless someone wants to comment, is to postpone this to the next FinCom, invite Dr. Clarkson, the mayor, the superintendent, and Mr. Condon to come in and talk about this issue. I think you will find Mr. Condon's revelations and comments very insightful.
Second. That was a motion, right?
Yes,
Was that a motion?
Yeah.
Okay. Second, just on the motion, the next, as we just discussed, the next FinCom meeting is Tuesday after the Monday. I believe that
Then
would...
do it the next one.
That'd be the,
Yeah,
where
do it
school
the next
committee
one.
meets as well.
We would, you're right.
Yeah.
Yeah.
So the following, what's that, the third Monday of September?
Yes.
Third Monday, correct, okay, because the next day,
Hold on a minute.
next day's election day, I believe.
Let me see.
Yeah, right.
What date would that be, Mr.
It'll be
Clerk?
September 15th and September
That's the date.
16th.
We usually don't meet the day
Correct.
before an
Correct.
election.
Correct.
So it would be the
First Monday of October.
first Monday in October.
October 6th.
And that's fine, because this is not a time-sensitive issue, so.
Okay, so motion is made, properly seconded to postpone this agenda item to October 6th Finance Committee meeting. All in favor? Anyone opposed? Matters postponed.
Thank you, councilors.
Thank you.
Be it resolved that the Mayor, Robert Sullivan, Chief Financial, do we vote? Yeah.
We did.
Move this along a little quicker here. Be it resolved that the Mayor, Robert Sullivan, Chief Financial Officer Troy Clarkson, and ARPA Project Manager Dan Pilata be invited to come before the Finance Committee to provide an update regarding ARPA projects, funding, spending, and infrastructure planning to date. Invited the Honorable Mayor Robert Sullivan, CFO Dr. Troy Clarkson, ARPA Project Manager Dan Pilata.
Good evening,
evening,
Mr.
Mr.
Mayor,
Chairman.
Dr. Clarkson, Mr. Pilata, welcome. I believe we have a presentation.
We do. We're going to have a PowerPoint. It's broken up. But first of all, I just want to thank all of you. As you all recall, when the ARPA money came into the city of Brockton, we got two different tranches, a little over $34.5 million directly from the federal government. Congressman Lynch came here. We had a wonderful day. And then almost 17.2 direct from our partners in Plymouth County. We do expect to get about $850,000 more from the county, because some of the municipalities in Plymouth County did not spend their share and cannot spend their share. So I had asked Dr. Clarkson, and he was ready, willing, and able to submit additional jobs, shovel-ready jobs or projects, and we've been awarded additional funds of ARPA, which is a win-win for the city of Brockton. But I also have said this many times to all of you, I was committed with this money, because it was once-in-a-lifetime money, to do legacy, long-standing projects for the city of Brockton. Other municipalities use the money to hire people or to do budget gap fillers. That was short-sighted. That was one-time funding, and they've paid the price. We didn't do that. And you know about all the projects, from the senior center 5,000 square foot addition, the war memorial for our veterans, this specific building, the Cosgrove pool, as you recall, we got $3 million directly from Joe Biden, President Biden's omnibus bill. Troy and I went down and asked the federal delegation to come up up with additional money as well, because we had committed $3 million of the ARPA money for the East Side Pool. So the $3 million of ARPA plus the $3 million of Omnibus, we were able to get a $6 million project over there. And then the 7 wards and 28 precincts, I committed to use money for parks and playgrounds in all the wards, and we've done that as well. DW Fields Golf Course up in Ward 7 and Council Azaks, we were able to replace all the windows at the clubhouse with ARPA money. It's the highest generating, or one of the highest generating revenue municipal golf courses in the Commonwealth. It's a phenomenal place to play golf. Father Bill's, as you recall, when they were relocating to Manley Street, we committed $650,000 of ARPA. $350,000 to make the million came directly from the county, because 65% of the Father Bill's folks are from Brockton, 35% are outside of Brockton, so that's how we came up with the $650,000 and $350,000. As you may recall, because a lot of you came the day we did an unbelievable ceremony downstairs, $2 million, almost $2 million, went to 43 different nonprofits in the city of Brockton, about $50,000 average per nonprofit in the city of Brockton. We also did the acquisition of the May Center, which is Bob Jones's school building, Shaw Center and Stadium. We used CARES Act funds, which was the precursor to ARPA, but we also used some ARPA money on some projects there. Public Safety Building, which is going to be opening next month, and you will all be invited, along with the governor, lieutenant governor, and federal delegation, state delegation. But we've committed money to the EOC, which is the BEMA component of that. When we have emergency situations, right now we use the War Memorial. We have a dedicated EOC room, which meets the parameters of ARPA money. Simple amount of money that I'm using for a project that needs to happen in the city of Brockton. When I became mayor, I was made aware that the Liberty Tree, our piece of history, was not owned by the city of Brockton. It was privately owned. We acquired it from a friendly taking for about $5,000. We own the Liberty Tree, and now we're going to use some ARPA money to put a bust there of Frederick Douglass. We're working with Mike Morris in procurement to get a wonderful sculptor, much like we did with the Marvelous Marvin Hagler statue. We will be getting the additional money, as I said. We want to use some of the money on the fresco downstairs. Again, when the fire happened in this building, drop ceilings were placed in front of the clerk's office. There is fresco, much like this ceiling in this beautiful room. So some component of the ARPA money will be used to showcase some of the fresco. We can't showcase all of it because steel beams were implemented as a result of the structural damage from the fire. And then some of the other things you're going to hear from both Dr. Clarkson and from Dan Pilata, our ARPA manager, is with additional money, departments have asked during the department head meetings for capital projects. Police chief has asked if we have any additional ARPA money to do revenue replacement so we can buy a couple more cruisers. Fire chief and DPW commissioner have asked similar requests as well. I have charged Troy to really do a deep dive on any money that's outstanding that we have, because thanks to Mr. Pilata, we've been at budget or under budget on all projects. I'll say that again, at budget or under budget on all projects. And we will continue to use the ARPA money in the way, again, that is long-lasting projects here in the city of Brockton. One thing that we may be looking at, as I mentioned last time I was before the body, the new occupant of the White House has made some serious cuts around the United States and here in Massachusetts. To date, the city of Brockton has lost $124,000. It was a federal earmark for the culvert on West Elm Street. That's a culvert, again, $124,000. We'll be able to spend it based upon a $500 million budget. But if there's a mechanism to have some additional ARPA money, that's money that we should spend both above ground and underground. Due to the fact that, hope to God soon we'll have a wonderful addition to the Boys and Girls Club over there. We'll have a wonderful soccer facility over there, at least a field, and then the public safety building, which will be the ribbon cutting next month. With that being said, again, I want to thank Dr. Clarkson and his team. All of you were given the spreadsheet, the financial breakdowns to the penny. We have been keeping track of everything since day one, because we want to make sure, number one, that every penny is spent. No money can go back to the Treasury or the Fed. That's been my mantra, and we will meet that standard and not reimburse any money back, because we are abiding by the regulations, and with Dan Pilata's expertise, we've been able to do some wonderful projects that will be generational. Thank you.
Thank you, Mr. Mayor. Dr. Clarkson.
Thank you, Mr. Chairman. I'll be brief. I just wanted to, before I introduce Dan, to give you a project-specific overview, and we do have a brief PowerPoint that'll show you some photos of some of the major projects, but then Dan can get into detail about the status of those projects. I just wanted to quickly go over the spreadsheet that we provided you. What we've done is track the spending per project and also track that based on the source of the funding. So as you can see in this spreadsheet, and you know what, I'll make sure that we post this on the finance page on the website so that if the public has any questions, we certainly want to get this information out there, because this is good news on important projects that have been lacking for a long, long time. So I won't read through each project, but as you can see, we provide you with the original money that was obligated under ARPA, what we've spent thus far, and on some of the projects there are funds remaining because the projects are either ongoing or there are simply additional funds. And as I just said a moment ago, we separated this spreadsheet out between the projects that were funded by the federal ARPA allocation and then by the county ARPA allocation. One point just to make, you can see the City Hall HVAC project appears both under the federal and the county, and that's because this was a large project, over $13 million. So we used a $10.7 million allocation from the county and then supplemented that with federal ARPA funds. The mayor went through a general list of the projects. I'm happy to answer any questions you have, but I do really want to thank the team in the finance office, particularly our budget director, Elvira Lopes, and Aaron Vega, one of our financial analysts, who have overseen the accounting of these funds. They've been meticulous about their record keeping, which is why we're able to provide this level of detail to you today. One final thing I do want to mention, the mayor touched on it, but just to explain to you, you can see the total projects that we've undertaken are almost $56 million. The amount of ARPA funding that was allocated was just less than 52, but that is because we received that $3 million earmark from the federal government for the pool, and then $1 million earmark that our legislative delegation was able to obtain from the Commonwealth to assist with the 5,000 square foot addition to the Council on Aging. So this has been really a game-changing opportunity to invest in the city. And as I introduced Dan Pallotta, who has years, decades really, of experience in construction management and oversight, I want to express the importance of the way we went about managing these projects, because as public projects, with the size and scope of them, many of them would have required individually hiring a company to oversee the projects as a project manager. The mayor and I made the decision to actually bring Dan and our construction assistant, Jerry Chipman, on as employees, and in doing so, I believe saved significant money because they are employees, and so they receive their compensation, but we're not required to then hire OPM owners, project managers for each project. That also provides a level of attention on these projects that has resulted, I think, in the successful either completion or implementation of some of these game-changing projects. This City Hall project is still ongoing. Dan will talk about that in a minute, but I do want to thank Dan and Jerry for their professionalism and their attention to detail. And with that, I'll gladly pass the microphone to Dan Pallotta.
Mr. Pallotta.
Thank you.
Good evening.
Thank you, Mr. Chairman. I don't know what I have to press here.
I think the arrow, right?
Just click.
The arrow down on the right.
All right.
Yep, there you go.
Is it on the screen? I don't see it on the screen.
He'll bring it up.
Oh, he'll bring it up? Okay. I wanted to just briefly go over the 5 major projects we've been working on. I've talked to a lot of the councilors individually over the last 3 or 4 years, and you almost all have the same questions. And I just thought it'd be a good idea to quickly go through it. I know everyone's tired, it's late, but I do want to talk about each building, what we found, and what you need to do to prevent them from getting in the same condition that we found them. If you can bring that up. I'm going to just keep going. Is that all right?
Yeah, that'll be fine.
It's just pictures.
Right. All the councilors do have a spreadsheet
all right.
in front
So
of them.
the first project we tackled was the War Memorial. The War Memorial the roof had been leaking in the War Memorial for at least 20 years. The plaster work inside the auditorium had failed. The steam lines in the building had failed. The overall condition of the building, although clean and well kept by your maintenance department, no capital had been spent on the building. We went in, we put in a new roof. We went in, we took out all of the steam heat, put in a new VRF heating system so that the entire building has not only heating and cooling, but fresh air as part of the COVID mandate for using COVID funds. So that building now has fresh air in it, changing twice an hour. The second project that we tackled was the Council on Aging. It took the most design work. It took us almost a year to design it, to get the programming right. The Council on Aging had a fire system that had been very poorly maintained. We had to replace the entire fire suppression system in a building that was only 20 years old. It's not something that should ever happen again in the city of Brockton. We have since obviously added on to the building and put in a very sophisticated HVAC system also in this building, and that is going to require maintenance. And my fear with that and with the War Memorial is that if we don't provide the maintenance and provide the necessary services to these systems yearly, the efficiencies that you're gaining on energy are going to slowly fade away, and then the systems themselves are going to slowly begin to fail. All of these energy efficient systems we're putting in under the new energy codes are wonderful, as long as they're maintained and they're monitored. The condition of the exterior of the building was in pretty tough shape. Some of the windows had failed. There was ponding. The parking lot hadn't been maintained. We had to resurface the parking lot. And pretty much just like the War Memorial, for 20 years, no real capital had been expended on the Mary Cruz Center. The Cosgrove Pool, built 1963 or 4 or 5, was in remarkably good shape for 60 years old, but it had gone beyond its useful life. We had completely removed the pool. The bathhouse is a different story. The bathhouse was barely habitable. We have left the bathhouse in beautiful condition, and it needs to be maintained. It is not a winterized building. It needs to be checked, and all the water needs to be drained out of it, and the roof needs to be checked. All of these things that your maintenance department needs to start doing on this building. Since there's no heat, no air conditioning in this building, there aren't any fancy systems other than the pool system, and I have to say Tim Carpenter knows an awful lot about pools. So I'm quite happy about that. This beautiful building, which is 131 years old, took the longest. We didn't expect it to take as long as it did. The roof went exactly as we expected it to. We believe we've stopped all water coming into this building from the roof, but we have not solved the problems of this building. This building has an electric system that is woefully undersized. We have electrical, we have literally bare electric wires in plaster in various sections of this building, meaning you got a positive and a negative in a wall, just plastered over, because they didn't need to insulate it back in, 1899 when electricity came to the building. The 26 gutters that are internal to the new slate roof, which are identical to what was put into this building, connect to a roof drain system that needs to be replaced. You're going to have water come in eventually. They're cast iron, they're 100 years old. We didn't have enough money to rip open every wall and replace every pipe. We did with the heating system, we did with the cooling system. We didn't have enough money to do it with the rain leader system. I'm begging you to please find the money somehow, some way to replace those rain leaders. When they leave the building, they go into cisterns outside the building, and when they leave the building, some of the cisterns are clogged, some of the drains to the street are clogged. There's just a lot of maintenance that needs to be done. Pat Hill cleaned everything out when we began our work on this building, and that needs to be done really, really bad. You need new electrical and you need new plumbing and roof drains. And finally, the parks. We only scraped the surface on the parks. We only did one park in each ward. We didn't do each park complete. We hope that we got to each one of your members' parks and you were satisfied with what we did. It's a beginning. Hopefully someone will pick up the ball and do the next 8 parks or complete the parks that we didn't complete. We tried to get all of the parks accessible as best as possible and eliminate dangerous conditions, but I can assure you there are dangerous conditions in a lot of your parks that need to be corrected. And again, I hope you can find a way to find the money for your parks, because every park that we did, I'd drive by weeks later and they would be full of children and parents playing. This building, we won't be finished for another couple of months, probably end of November. You currently are getting fresh air in this building for the first time since this building was built. That was turned on 2 weeks ago. The air is not stale in the building. Those of you that work here, if you haven't noticed it, I can tell you your air is changing twice an hour in the areas of the building that we have completed. We have 2 phases left to go. The reason that this building took longer than we had expected is we expected to do 1 floor at a time. We even met with former President Rodriguez about taking this hall for a month when we were going to be doing this floor. And unfortunately, the conditions of the building next door that we were temporarily renting were so horrific that we had to completely change the way we did the building. We shifted on the fly and went section by section, room by room throughout the building. So we'll be done in a couple of months, and that will complete the 5 major ARPA projects. The town of Hanover didn't spend their ARPA money. We have been graciously given $850,000 more from the County of Plymouth that was once allocated to Hanover, and we are going to be putting in 2 new boilers to completely complete the entire loop, as well as the cooling tower in this building. So every part in this building, with the exception of the chiller, which is only 10 years old, has been replaced, and it should last you for another 20 or 30 years. And I'm here to answer any questions I can.
Councilor Castro.
Thank you. Good evening. Thank you for being here. Mr. Pilata, what a drive you have ahead of you. So I have just several quick questions. Moments ago, you mentioned when discussing the City Hall envelope and HVAC upgrades that internal gutters that connect to the roof will need replacement and they're cast iron.
Internal rain leaders that the gutters connect to.
Rain leaders.
We installed brand-new gutters, copper gutters, that transfer from the copper gutter spout into cast iron rain leader.
After you take a drink, any sense of how much that costs?
I haven't really looked at it because it was beyond my scope, but there's 22 of them.
22, oh my God. Okay, so that was my first question. My second question is on the one-page blue and white sheet, the last entry under federal ARPA projects is revenue replacement. And I wonder, what is that for?
I can answer that. So, under the American Rescue Plan Act, the recipients of the money were allowed to use a certain percentage of the funding for what's called revenue replacement. It was a pretty broad category, and that's what the mayor was referencing. In some cases, the maximum was $10 million. In our case, I believe we could have used up to $10 million in revenue replacement. That's where a lot of communities, particularly many in Massachusetts, got into trouble because they plugged holes in their budgets with that revenue replacement money. We did not do that. I do have a listing, and I anticipated that question, of how we use the revenue replacement money, and I'm glad to provide the whole list to you, Councilor. But just as an example, we purchased a refuse truck, police cruisers, because we weren't funding with regular capital funding, a dump truck for the DPW, an upgrade of Tyler Technologies to the cloud, which is our accounting software, a van for animal control, the Frederick Douglass bust that the mayor referenced. Will be using revenue replacement money for that. We're conducting a feasibility study on the DPW building at Montauk Road, looking at potential future renovation or replacement of that building. The carpet in this room will soon be replaced. We'll be using revenue replacement for that, because so there are projects that don't specifically fit within the four corners of ARPA, but the law was flexible enough that it allowed us to do some of those items with those funds.
That's great, thank you. My last question is, Councilor Azak and I sit on the Accounts Committee this year, and we recall at the last meeting or two being told that there were ARPA funds allocated to the schools that the schools did not use and had to be returned. And I'd like to ask, all right, if it wasn't ARPA, then it was CARES Act, but there were federal funds that came in that weren't used and had to be returned, right?
It wasn't ARPA or CARES.
So I think I can, the schools were allocated funds through the American Rescue Plan Act.
Right.
Those were called, and Dan is correct, those were called ESSER funds. And so the schools were allocated ARPA monies in separate allocations. The school funding was not part of this spreadsheet that's before you. I think what you might be referencing, because I know this came up at the Accounts Committee, was when the allocations were made for the CARES Act, the school department overspent their allocation and spent additional CARES Act funding beyond what was allocated. And so, as we've discussed in this room several times, we are carrying that deficit every year with the Department of Revenue of those CARES funds that the school department overexpended.
And is that about $3 million?
A little less than $4 million.
Thank you. Thank you, Mr. Chair.
Thank you, Councilor. Anyone else? I just, a couple of quick questions, if that's okay. Number one, Sycamore Grove. I know I'm broken record about Sycamore Grove, but it seems that I think our last conversation was that there was a potential to allocate about $100,000 to Sycamore Grove to draw up an engineering plan that we could then further seek grant funding to try to implement that plan. I was wondering if that $100,000 was available, and that if that's a situation that we could still contemplate.
As the ARPA manager, my response on Sycamore Grove remains the same, that we never have ever had enough money to do the entire Sycamore Grove, but the best path would be to do those plans so that we can get an earmark from either the Commonwealth or the federal government at a time when there's those funds available. That has not moved forward as the encroachments by three of the abutters have not been resolved to my knowledge. So I have not been given the green light by anybody to move forward with that at this time, Mr. Chairman.
Would those encroachments have to be resolved to develop a plan?
I think it would be ill-advised to spend one-time funds on a project that can't be done unless those are, I mean, if we develop the plan, it's going to be a plan based on the fact that those encroachments have been resolved.
Does the 100,000 exist if those encroachments are resolved?
That would be for the mayor to tell me to move forward. I mean, I think you can read the chart. There are some funds left over.
Councilor, there will be. I know on Troy's spreadsheet it says the Frederick Douglass bus is 100 grand, it's 50 grand. We're going to have some surplus that we're going to earmark. Again, I've made you a pledge. I want to at least beautify that with green, put up some beautification areas and plantings. But until the encroachments, it's kind of putting good money into a project that would never come to fruition without the legal ease being changed. But we would have the 100 grand.
Okay, I appreciate that, Mr. Mayor. And then just lastly, right now, tell me if this is true, Mr. Mayor, or not, but are we unable to use City Hall Plaza right now due to the current construction?
Yeah, we have not. That's why we're doing the flag raisings inside. Out of abundance of caution, we just haven't. We will be in the near future opening up again. There was a little bit of damage, probably where some of you park, you've seen it. Some of the weight of some of the equipment, and especially a crane. We had a massive crane here. Some of that has to be repaired, and then we're going to be back to normal out there.
Okay, great. Because, we all miss the use of City Hall Plaza. A lot of different organizations love using that. And the city itself, we have September 11th coming up. That's always a great place to hold that event.
We will.
So it'll be open because then we also have our holiday parade, and we just want full use of that area. So if you're telling me that it will be, that's wonderful news. Great. Councilor Azak.
Just have a quick question or also a comment. First of all, thank you, gentlemen and mayor. I think this is great. You've really spread it out throughout the city, which is really good to see in different areas, so the money didn't just go in on one thing. So I think that's really great. And thank you for everything in Ward 7. So personally, thank you for that. So we're not sure about how much is left depending on what some of these projects are going to cost, if I understood correctly. Yes?
That's correct.
Okay, perfect. So when, do we have a timeline of when when we would know, what would be left?
So, I'm just going to grab this for Dan, because I gave my spreadsheet to Chris from the Enterprise. So you can see, no, that's all right, thank you. We want you to have that, Chris, for the record. So you can see the public safety EOC, there is $699,000 remaining out of that allocation. We haven't spent any of that yet. That was a buffer in case the EOC portion of that project ran over. I have asked Director Hook to identify some equipment that they could use, that we could potentially use that funding for. The revenue replacement, there are some funds remaining there. We do have some capital requests from departments, and as Dan mentioned, out of the $850 from the county, we expect to spend about $500 of that for new boilers for this building, but we do anticipate some of that money being available. The mayor did mention he'd like to allocate some of that to do some fresco work. So it's still in flux, but we do have the ability to expend some more of those funds on other items. I will tell you, we work closely. Aaron Vega is the point person on maintaining all of this information, and but we rely on a consultant, CSS, and you've heard about CSS before. They advise us on several different items. They're sort of our subject matter expert, and what they tell us is we can still move money within these allocations, but the time has passed to develop any new categories. So we do have some flexibility in revenue replacement. If you had some ideas, Councilor, on funding priorities. But in terms of creating new projects, we're fairly limited.
Council, one project we are going to do with ARPA money is the Little Red Schoolhouse. It's a travesty the way it is. I signed a contract the other day. We have an architect that we've engaged. There's been a lot of, I've been trying to fight this for 5 years. It's a lot of people use that as the real main entrance into Brockton High from Forest Ave, and it's an eyesore. It's pathetic. It's a piece of history. We have Brocktonians. George Carney went there as a student. He's 97 years young. So, you know, we need to not just beautify the area. We need to do some architectural integrity of it. There's pieces of a clapboard coming off, pieces of the windows are coming off. In the past, we were told, no, you can't do it, City of Brockton, because it's historic. I think we're going to do it because it's our history. You know, the windows were replaced. Eagle Scouts did a handicap ramp. They didn't get state approval from the Historic Commission. So we are engaged. We already signed it. We have an architect doing that. It's not going to be a ton of money, but it's going to be ARPA money that's revenue replacement. So that is a new project, but it meets the parameters, and it's actually a good project for the City of Brockton.
Oh, that's great. I'm happy to hear that because that Little Red Schoolhouse is really, it's a great piece of history for Brockton. Okay, so my question is, do we have a time that we have to have this complete without losing any funding?
Yes. So all of the funds have to be expended by the end of calendar year 2026.
Okay, so a year.
And so that's why you see some of these categories are unspent. For instance, the monies that pay Dan's salary and Jerry Chipman's salary. We have some procurement assistance that we pay for. The consultant I mentioned from CSS, we've projected those expenses out until the end of calendar year 2026.
Okay, and last question. So just the 4 million, that's highlight 4,535,062.
Yes.
100.02. What is that exactly?
So that for the rest of the council, that is in the bottom right-hand corner of your spreadsheet. So that tallies all of those remaining funds you see on the right-hand side. So that's all the funds that are unspent. But for instance,
that haven't been paid yet.
Right.
Yeah. Okay.
2.4 million of that is for this project. So that money's really not available because we do anticipate spending most or all of that. Correct. It's just the project isn't done yet.
Okay, very good. Thank you very much. And if nobody has any questions, I will recommend this favorably back to the full City Council.
Second.
Motion is made, properly seconded, to recommend this resolve favorably. All in favor? Anyone opposed? The resolve is recommended favorable.
Thank you, Mr. Chairman.
Thank you, Ms. Plata, Dr. Clarkson, and Mr. Mayor. Thank you for joining us.
Thank you.
Councilors, that's the end of our agenda. Anyone have any councilor recognition?
Mr. Chairman, if I could just remind everybody, this Thursday night is Doug Flutie night up at the Rocks, 6:45 p.m. There will be free admission. They're trying to get a lot of people there. It's actually sponsored by Eastern Bank, which is acquiring Harbor One. So it'd be a great night, great baseball, and I hope to see everybody there. Thank you.
Thank you, Mr. Mayor. Councilor Azak.
Thank you. And Doug Flutie, wasn't he a BC alum?
Yes, he was. Go Eagles.
He's also a Pat Lebanese.
Of course he is.
So I would like to announce that DW Fields Park is having its centennial birthday celebration this coming Friday and Saturday, August 22nd and 23rd. Time is from noon to 7 p.m. There's going to be live music, food trucks, crafting, dancing, and I believe I saw hay rides somewhere. So it sounds really exciting. I know the Friends of the DW Fields Park have been planning this in collaboration with other organizations in the city, as well as the mayor's office. So this is going to be a great event. Please come out and celebrate DW Fields Park's centennial birthday this Friday and Saturday. And also this weekend, so a lot of good things happening in Brockton. We have the annual Lebanese Festival. This year it's at it's earlier in the year. It's in August. It's at St. Teresa's Church, located at 343 North Main Street. The festival will start Friday from 5 to 11 p.m., so Friday, August 22nd, and it will go to Sunday, August 24th, and the times for Saturday and Sunday are from 12 to 5 p.m. So please come by, enjoy some great music, dancing, and obviously the best Lebanese food there is. So very busy weekend here in Brockton. Thank you, Mr. Chairman.
Thank you, Councilor. Anyone else? Seeing none, and with no further city business before this committee, I declare this meeting adjourned.